Hey everyone, tonight we're diving into something that might completely change how you think about ancient medicine. We're talking about the sophisticated medical knowledge of indigenous peoples across the Americas, knowledge so advanced that modern science is still catching up. Before you get comfortable, take a moment to like this video if you're genuinely interested in learning about these incredible healing traditions. And let me know in the comments where you're watching from and what time it is where you are. It's always fascinating to see our global community come together around these stories. Now, settle in, maybe dim the lights, and let's journey back thousands of years to explore medical practices that were saving lives when the rest of the world was still figuring out basic hygiene. Tonight's story isn't just about plants and potions, it's about surgical procedures that had higher success rates than Civil War medicine, botanical knowledge that became the foundation for modern pharmaceuticals, and spiritual healing practices that address the whole person, not just symptoms. Picture this. You're a French explorer in 1536, trapped in what would become Quebec City. Winter has set in, your crew is dying of scurvy, and European medicine has no answer. Then the local Iroquois people offer you a simple tea made from evergreen needles. Within weeks, your dying men are walking around healthy again. That wasn't luck. That was sophisticated medical knowledge that had been refined over thousands of years. When we think about ancient medicine, most people imagine primitive remedies and superstitious rituals. But the reality of indigenous American medicine was startlingly different. These weren't desperate attempts at healing by people who didn't understand the human body. These were comprehensive medical systems developed by cultures that had been observing, experimenting, and perfecting their craft for millennia. The indigenous peoples of North and South America developed what might be the most sophisticated botanical pharmacy the world has ever known. They didn't just randomly try plants to see what worked. They developed systematic approaches to understanding which plants treated which conditions, how to harvest them at the right time, how to prepare them for maximum effectiveness, and how to combine them for enhanced therapeutic benefit. Take willow bark, for example. Long before aspirin was synthesized in a German laboratory, Native American tribes were chewing willow bark to treat headaches, fever, and body aches. They knew exactly which species of willow to use, when to harvest the bark, and how to prepare it for different conditions. What they were doing was extracting salicin, the natural compound that would eventually become the basis for aspirin, the most widely used drug in the world today. But this wasn't just about one plant. The Cherokee, Iroquois, Ojibwe, and dozens of other tribes had developed detailed knowledge of hundreds of medicinal plants. Black cohosh for women's health issues, echinacea for immune support, golden seal for infections, witch hazel for inflammation. Each plant was understood not just in isolation, but as part of a complex system of medicine that addressed the whole person. What makes this even more remarkable is how this knowledge was preserved and transmitted. Without written language in many cases, these medical traditions were passed down through oral teaching that was incredibly precise. Healers didn't just memorize which plants to use. They learned the songs, ceremonies, and spiritual practices that accompanied the medicine. They understood that healing wasn't just about the right chemical compound. It was about the relationship between the healer, the patient, the plant, and the spiritual forces that governed health and illness. The four sacred medicines, tobacco, cedar, sage, and sweetgrass, formed the spiritual foundation of many healing practices. But these weren't just ceremonial plants. Each had specific medicinal properties that had been carefully studied and documented through generations of use. Tobacco, the sacred plant that connected prayers to the Creator, was also used as a poultice for wounds, an emetic for poisoning, and a treatment for respiratory conditions. Cedar and sage had antimicrobial properties that made them perfect for cleansing ceremonies and treating infections. Sweetgrass contained natural blood thinners that could help with circulatory issues. The sophistication of this botanical knowledge becomes even clearer when you look at how different tribes used the same plants. Take currants and gooseberries. The Comanche used berry tea as a gargle for throat inflammation. The Prairie Potawatomi made a root decoction for eye infections. The Muskogee Creek tribe used root bark tea to expel intestinal worms. These weren't random applications. Each tribe had discovered specific ways to extract and use the active compounds in these plants for targeted therapeutic effects. Even more impressive was how indigenous healers maximized the therapeutic potential of individual plants by using different parts for different purposes. The California poppy serves as a perfect example. The Costanoan tribe used the flowers as a tea to kill head lice. The Ohlone people crushed the seeds and mixed them with bear fat as a hair tonic. Every part of the plant, from roots to flowers to seeds, was understood to contain different concentrations of active compounds that could be harnessed for specific health needs. This level of botanical sophistication extended to plants that modern medicine has only recently begun to understand. Milkweed, for instance, was used by multiple tribes in remarkably specific ways. The Miwok people used the latex to remove warts, understanding its caustic properties. The Cheyenne made a decoction from dried plant tops to treat snow blindness, a condition specific to their geographic environment. Cherokee, Delaware, and Mohegan peoples used butterfly milkweed root as a cough remedy, recognizing its expectorant and bronchodilator properties. What's fascinating is how this knowledge was constantly being refined and improved. Different tribes would share information about medicinal plants, leading to new applications and preparation methods. They were conducting what we would now recognize as clinical trials, carefully observing the effects of different plants and preparations on various conditions, then passing that knowledge down through their healing traditions. The precision of this botanical medicine becomes even more apparent when you consider seasonal harvesting. Indigenous healers knew that the active compounds in medicinal plants varied throughout the growing season. They developed detailed calendars for when to harvest different plants for maximum therapeutic effect. Spring roots, summer flowers, fall berries, winter bark. Each season offered different medicinal opportunities, and traditional healers knew exactly when to take advantage of them. But perhaps the most remarkable aspect of indigenous American medicine wasn't the botanical knowledge, though that was extraordinary. It was the surgical procedures that these cultures had developed. When we think about ancient surgery, we usually imagine crude operations with minimal chance of survival. The reality of indigenous American surgery was completely different. Trepanation, the surgical removal of sections of the skull, was practiced throughout the Americas for thousands of years. But this wasn't primitive surgery. Archaeological evidence shows that indigenous surgeons achieved survival rates that wouldn't be matched by European or American doctors until the 20th century. In ancient Peru, surgeons performing trepanation had survival rates of up to 91% during certain periods. Compare that to American Civil War surgeons, who lost nearly half their cranial surgery patients. These weren't lucky accidents. Indigenous surgeons had developed sophisticated understanding of neuroanatomy, pain management, and surgical technique. They knew exactly where they could cut without causing fatal damage. They understood that the scalp had many nerves and would cause significant pain, but that the skull itself had few nerve endings. They knew not to penetrate the dura mater, the protective membrane around the brain, because that would cause fatal infections. Their anesthesia techniques were remarkably advanced. They used coca, datura, and other plant-based compounds to manage surgical pain. They gave patients fermented beverages to induce drowsiness and reduce anxiety. They had developed specialized surgical tools like the tumi, a curved metal knife designed specifically for cranial surgery. These weren't improvised procedures. They were highly refined surgical techniques that had been perfected over generations. The sophistication of indigenous surgical knowledge extended beyond trepanation. Native American surgeons practiced joint aspiration, debridement, and thoracentesis. They had developed suturing techniques for closing wounds. They had even invented syringes, using animal bladders and bird bones to create tools for injecting medications and irrigating wounds, centuries before Europeans developed similar technology. What made all of this possible was a fundamentally different approach to medical knowledge. Indigenous American medicine wasn't just about treating disease. It was about understanding the complex relationships between physical health, spiritual well-being, and environmental balance. Healers, often called medicine men or women, were trained not just in botanical and surgical knowledge, but in the spiritual and ceremonial practices that were believed to be essential for effective healing. This holistic approach to medicine meant that treatment addressed not just the immediate symptoms of illness, but the underlying causes. If someone was sick, it might be because they were out of balance spiritually, emotionally, or with their community. Healing involved not just the right plant medicine or surgical procedure, but the appropriate ceremonies, prayers, and community support to restore that balance. The shamanic tradition, which dates back tens of thousands of years, represents one of the earliest and most comprehensive approaches to healing ever developed. Shamanic healers served as intermediaries between the physical and spiritual worlds, using their knowledge of both botanical medicine and spiritual practice to diagnose and treat illness. They understood that true healing required addressing the whole person, not just the diseased body part. This integration of spiritual and physical healing wasn't primitive superstition. It was sophisticated medicine that recognized what modern science is only beginning to understand about the connections between mental health, social support, spiritual well-being, and physical health outcomes. Indigenous healers had developed what we would now call psychosomatic medicine, understanding that the mind and body were inseparable in the healing process. The legacy of this ancient medical knowledge continues to influence modern medicine in ways that most people don't realize. Hundreds of modern pharmaceutical compounds were first discovered in plants that indigenous peoples had been using medicinally for thousands of years. The pain relievers, antibiotics, and cancer treatments sitting in your medicine cabinet right now might trace their origins back to the botanical knowledge of Native American healers. But it's not just about individual compounds, it's about approach. Modern medicine is beginning to recognize the value of treating the whole person, not just the disease. Integrative medicine, holistic health practices, and the growing understanding of how social and spiritual factors influence health outcomes all echo the comprehensive approach that indigenous American healers had been using for millennia. For millennia. The impact of this medical tradition becomes even more fascinating when you examine how indigenous knowledge systems actually worked in practice. These weren't isolated healers, working alone with mysterious remedies. They were part of sophisticated medical networks that spanned entire continents. Trade routes carried not just goods, but medical knowledge. A healing technique developed by the Inca might make its way north through generations of tribal contact, eventually reaching peoples thousands of miles away. Plant medicines discovered in one region would be traded to areas where those plants didn't grow naturally. This created a continental medical system where knowledge was constantly being shared, tested, and refined. The training of indigenous healers was incredibly rigorous. It could take decades to become a fully qualified medicine person. Apprentices didn't just learn which plants to use, they learned to read the landscape, to understand weather patterns, to recognize the subtle signs that indicated when a plant was at peak potency. They studied human anatomy through careful observation of injuries and illnesses. They memorized vast oral traditions that contained not just medical knowledge, but the cultural and spiritual context that made that knowledge effective. Consider the complexity of what a traditional healer needed to master. They had to know hundreds of plants and their properties. They needed to understand human anatomy and physiology. They had to be skilled in surgical procedures. They needed to know the spiritual and ceremonial aspects of healing. They had to understand community dynamics and psychology. They were essentially doctors, pharmacists, surgeons, psychologists, and spiritual counselors all rolled into one. The diagnostic skills of these healers were remarkably sophisticated. They could assess a patient's condition through careful observation of symptoms, but also through understanding the person's life circumstances, relationships, and spiritual state. They recognized that illness often had multiple causes and required multiple approaches to treatment. This systems thinking approach to health was far ahead of its time. Take the example of how indigenous healers understood what we now call psychosomatic illness. They recognized that emotional trauma, social conflicts, and spiritual imbalance could manifest as physical symptoms. Their treatments addressed not just the physical manifestation of illness, but the underlying emotional and spiritual causes. They understood that you couldn't heal the body without healing the mind and spirit. The precision of indigenous pharmacology becomes even more impressive when you look at how they combine different plants to create specific therapeutic effects. They understood drug interactions and synergies centuries before modern pharmacology existed. They knew which plants enhanced each other's effects and which combinations to avoid. They had developed sophisticated understanding of dosing, timing, and administration routes. For respiratory conditions, they might combine butterfly milkweed root with other expectorant herbs to create more effective treatments than any single plant could provide. For infections, they would use combinations of antimicrobial plants that worked through different mechanisms, creating broad-spectrum treatments that were remarkably effective. They understood that the whole was often greater than the sum of its parts. The seasonal aspect of indigenous medicine reveals another layer of sophistication. These healers understood that human health needs change throughout the year, just like plant medicine availability. Spring cleanses helped the body transition from winter to summer. Fall preparations strengthened the immune system for the coming cold season. They had developed year-round health maintenance protocols that kept people healthy, rather than just treating them when they became sick. This preventive approach to medicine was revolutionary. While European medicine was focused on treating disease after it occurred, indigenous American medicine emphasized maintaining health and preventing illness. They understood that it was much easier to keep people healthy than to cure them after they became sick. This led to comprehensive lifestyle recommendations that included diet, exercise, spiritual practice, and community involvement. The role of ceremony in indigenous medicine deserves special attention because it reveals how sophisticated their understanding of healing really was. Ceremonies weren't just religious observances. They were therapeutic interventions that addressed psychological, social, and spiritual aspects of health. Healing ceremonies brought communities together to support sick individuals. They provided frameworks for processing trauma and grief. They reinforced cultural values and social bonds that contributed to overall community health. The vision quest, practiced by many Plains tribes, serves as an excellent example of how ceremony and medicine intersected. This rite of passage involved fasting, isolation, and spiritual seeking that served multiple medical purposes. It provided a framework for processing the psychological challenges of adolescence. It strengthened mental resilience and self-reliance. It connected young people to their cultural identity and spiritual beliefs. It was essentially a comprehensive mental health intervention disguised as a spiritual ceremony. Similarly, the sweat lodge ceremony served important medical functions beyond its spiritual significance. The heat and steam helped with respiratory conditions. The sweating process aided detoxification. The group participation provided social support and stress relief. The ceremony created a safe space for emotional expression and psychological healing. It was a comprehensive therapeutic intervention that addressed physical, mental, and spiritual health simultaneously. The surgical innovations of indigenous American peoples extended far beyond trepanation. Archaeological evidence reveals sophisticated orthopedic procedures, including the setting of complex bone fractures and joint reconstructions. Indigenous surgeons had developed techniques for treating compound fractures that wouldn't be matched by European medicine for centuries. They understood the importance of surgical cleanliness even though they didn't know about germ theory. They developed procedures for sterilizing instruments and surgical sites using heat and antimicrobial plants. They had protocols for post-operative care that minimized infection and promoted healing. Their understanding of wound healing was remarkably advanced, including techniques for promoting tissue regeneration and minimizing scarring. The anesthesia techniques used by indigenous surgeons were particularly sophisticated. They had identified multiple plant compounds with analgesic and sedative properties. They understood how to combine these substances to achieve different levels of consciousness during surgery. They knew how to manage pain during long surgical procedures and how to help patients recover from anesthesia safely. Coca leaf, used extensively in South American surgery, contains cocaine alkaloids that provide excellent local anesthesia. Indigenous surgeons knew how to prepare and apply coca to achieve surgical anesthesia without the dangerous systemic effects of pure cocaine. They had developed precise dosing protocols that maximized pain relief while minimizing side effects. Datura, another plant used for surgical anesthesia, contains tropane alkaloids that produce sedation and amnesia. Indigenous healers knew how to prepare datura preparations that would keep patients calm and pain-free during surgery, while avoiding the dangerous hallucinations and toxicity that could result from improper use. This level of pharmacological precision was remarkable for its time. The success rates of indigenous surgery become even more impressive when you consider the conditions under which these procedures were performed. Without modern operating rooms, sterile equipment, or pharmaceutical backup, indigenous surgeons achieved survival rates that rival modern medicine. This was possible because of their comprehensive understanding of human anatomy, surgical technique, infection prevention, and post-operative care. The tools used by indigenous surgeons were marvels of engineering and craftsmanship. The Toomey knives used for cranial surgery were precisely shaped and balanced for maximum surgical effectiveness. Obsidian blades, sharper than modern steel scalpels, were used for delicate procedures requiring minimal tissue damage. Bone needles and plant fiber sutures were designed for specific surgical applications. The development of the hypodermic syringe by Native American peoples demonstrates their innovative approach to medical technology. Using animal bladders as syringes and hollow bird bones as needles, they created effective tools for administering medications and irrigating wounds. These devices were used for everything from treating infections to administering enemas to delivering ceremonial medicines. The larger versions of these syringes were used for therapeutic enemas that treated digestive disorders, constipation, and hemorrhoids. They were also used to administer hallucinogenic medicines during healing ceremonies, allowing for precise dosing of powerful plant compounds. This technology predated European syringes by centuries and demonstrates the practical engineering skills of indigenous peoples. The integration of surgical and botanical medicine created comprehensive treatment protocols that addressed complex medical conditions. A patient with a head injury might receive surgical treatment to relieve pressure on the brain, followed by plant medicines to reduce inflammation and promote healing, combined with ceremonies to address the psychological trauma of the injury. This multifaceted approach to treatment was remarkably effective. The training of indigenous surgeons required mastery of multiple disciplines. They needed to understand anatomy and physiology. They had to be skilled in the use of surgical instruments. They needed knowledge of botanical medicines for anesthesia and post-operative care. They had to understand the spiritual and ceremonial aspects of healing. They were essentially specialists who had achieved expertise across multiple medical fields. The quality control systems used by indigenous healers ensured consistent and safe medical practice. Knowledge was transmitted through rigorous apprenticeship programs that required demonstration of competency before practitioners were allowed to treat patients independently. Healing societies and medicine organizations maintained standards and shared knowledge across tribal boundaries. The record-keeping systems used by indigenous peoples, though often oral rather than written, were remarkably detailed and accurate. Healers memorized vast amounts of information about patient treatments, outcomes, and side effects. This information was carefully preserved and transmitted to future generations, creating databases of medical knowledge that spanned centuries. The seasonal calendars used by indigenous healers contained precise information about when to harvest different medicinal plants for maximum potency. These calendars were based on careful observation of plant biology and chemistry over many generations. They understood that the concentration of active compounds in medicinal plants varied throughout the growing season and had developed detailed protocols for optimal harvesting times. The geographic specialization of different healing traditions created a continental network of medical expertise. Coastal peoples developed sophisticated knowledge of marine-based medicines. Desert dwellers became experts in drought-resistant medicinal plants. Mountain peoples specialized in high-altitude healing techniques. This geographic diversity created a comprehensive medical system that could address the health challenges of any environment. The trade networks that connected these different medical traditions ensured that knowledge and medicines could reach people far from their places of origin. Pacific coast shells used in healing ceremonies made their way to the Great Plains. Medicinal plants from the Amazon reached healers in North America. This continental exchange system created one of the world's most comprehensive medical traditions, D's most comprehensive medical traditions. The diagnostic methods used by indigenous healers reveal a level of medical sophistication that modern practitioners are only beginning to appreciate. These weren't healers who relied solely on guesswork or spiritual intuition. They had developed systematic approaches to medical diagnosis that combined careful physical examination with deep understanding of human behavior and environmental factors. Traditional diagnostic techniques included detailed observation of pulse patterns, something that predated similar practices in traditional Chinese medicine. Indigenous healers could detect subtle variations in pulse quality that indicated different types of illness. They understood that the pulse wasn't just about heart rate, but reflected the overall state of the circulatory system and could reveal problems with specific organs or body systems. The examination of the tongue was another sophisticated diagnostic tool. Healers knew that changes in tongue color, texture, and coating could indicate various internal conditions. A pale tongue might suggest blood deficiency, while a red tongue could indicate inflammation or fever. These diagnostic signs were carefully catalogued and passed down through generations of medical training. Eye examination was particularly advanced among many tribes. Healers could diagnose liver problems, nutritional deficiencies, and even emotional states by carefully observing the eyes. They understood that the eyes were windows not just to the soul, but to the overall health of the body. Yellowing of the whites could indicate liver dysfunction, while changes in pupil response might suggest neurological problems. The assessment of body odors was used as a diagnostic tool in ways that modern medicine is only beginning to understand. Indigenous healers knew that different diseases produce characteristic smells. Diabetes produced a sweet, fruity breath odor. Kidney problems created an ammonia-like smell. Certain infections had distinctive odors that experienced healers could identify immediately. Urine examination was conducted with remarkable precision. Healers could assess color, clarity, smell, and even taste to determine various health conditions. Sweet-tasting urine indicated what we now know as diabetes. Cloudy urine suggested kidney problems. Dark urine might indicate liver dysfunction or dehydration. These diagnostic techniques were based on careful observation and correlation with patient outcomes over many generations. The psychological assessment skills of indigenous healers were particularly advanced. They understood that mental and emotional states profoundly affected physical health. They could recognize depression, anxiety, and trauma through subtle behavioral cues. They knew that unresolved grief could manifest as physical illness and that social isolation could weaken the immune system. Family history was carefully considered in diagnosis and treatment planning. Indigenous healers understood that certain conditions ran in families and that genetic predisposition affected treatment outcomes. They would ask detailed questions about the health of parents, grandparents, and siblings when developing treatment plans. Environmental factors were always considered in medical diagnosis. Healers understood that exposure to certain plants, animals, or weather conditions could cause illness. They knew which diseases were more common during certain seasons and could often predict health problems based on environmental changes. The treatment of infectious diseases by indigenous healers demonstrates remarkable understanding of disease transmission and treatment. They had identified numerous antimicrobial plants and developed sophisticated protocols for treating infections. Golden seal, containing the powerful antibiotic compound berberine, was used to treat bacterial infections. Echinacea was used to boost immune function and help the body fight off viral infections. The use of isolation and quarantine procedures shows that indigenous peoples understood disease transmission long before germ theory was developed. When smallpox and other epidemic diseases struck, many tribes implemented sophisticated quarantine protocols that limited the spread of infection. They understood that some diseases could be transmitted through contact with infected individuals and developed procedures to protect healthy community members. The treatment of wounds and injuries reveals advanced understanding of infection prevention and wound healing. Indigenous healers used various antimicrobial plants to clean wounds and prevent infection. They understood the importance of removing foreign material from wounds and had developed sophisticated debridement techniques. They knew which plants promoted healing and which ones should be avoided because they could delay recovery. Honey was used extensively in wound care by many tribes. They understood that honey had antimicrobial properties and could prevent infection while promoting healing. Modern research has confirmed that honey is indeed an effective antimicrobial agent and wound healing promoter, validating thousands of years of indigenous medical practice. The use of maggot therapy for wound cleaning demonstrates remarkable medical sophistication. Some tribes deliberately introduced certain types of maggots into infected wounds because they understood that the maggots would consume dead and infected tissue while leaving healthy tissue intact. This technique, which seems primitive to modern sensibilities, is actually highly effective and has been reintroduced in modern medicine for treating certain types of difficult wounds. The treatment of fractures and orthopedic injuries by indigenous peoples was remarkably advanced. They had developed sophisticated splinting techniques using natural materials like bark, reeds, and plant fibers. They understood the importance of proper alignment and immobilization for bone healing. They knew how to set complex fractures and had developed techniques for treating dislocations and other joint injuries. The use of traction for treating certain types of fractures shows sophisticated understanding of orthopedic principles. Indigenous healers knew that some fractures required sustained pulling force to maintain proper alignment during healing. They developed ingenious traction devices using ropes, pulleys, and counterweights to provide the necessary force while allowing patients to remain relatively comfortable during the healing process. Physical therapy and rehabilitation techniques were well developed in indigenous medicine. Healers understood that injured patients needed gradual return to activity to regain full function. They had developed specific exercises and activities designed to restore strength, flexibility, and coordination after injuries. These rehabilitation protocols were based on careful observation of what worked best for different types of injuries. The treatment of burns was particularly sophisticated. Indigenous healers had identified numerous plants with cooling and healing properties for burn treatment. Aloe vera was used extensively for its soothing and healing effects on burned skin. Various tree barks were used to create protective coverings for burns. They understood the importance of preventing infection in burn wounds and had developed effective protocols for burn care. Pain management techniques extended far beyond plant medicines. Indigenous healers used various physical techniques, including massage, heat therapy, and cold therapy to manage pain. They understood that different types of pain responded to different treatments and had developed comprehensive pain management protocols that addressed both acute and chronic pain conditions. The use of hydrotherapy was common among many tribes. They understood that water could be therapeutic when used properly. Hot springs were used to treat arthritis and other inflammatory conditions. Cold water immersion was used to reduce inflammation and promote healing after injuries. Steam baths were used for respiratory conditions and general health maintenance. Massage therapy was highly developed among indigenous peoples. Different tribes had developed specific massage techniques for various conditions. Deep tissue massage was used for muscle injuries, Gentle massage was used for circulation problems. Pressure point massage was used for pain relief. These techniques were based on detailed understanding of human anatomy and physiology. The use of exercise as medicine was well established in indigenous cultures. Healers understood that physical activity was essential for maintaining health and recovering from illness. They prescribed specific exercises for different conditions and had developed comprehensive fitness protocols for people of all ages. Dancing, running, swimming, and various games were all used as therapeutic interventions. Dietary therapy was an integral part of indigenous medicine. Healers understood that food was medicine and that proper nutrition was essential for health and healing. They had developed detailed knowledge of which foods promoted health and which ones should be avoided during illness. They understood that different conditions required different dietary approaches. Fasting was used therapeutically by many tribes. They understood that temporary food restriction could help the body heal from certain conditions. Fasting was used to treat digestive problems, infections, and various chronic conditions. They had developed safe fasting protocols that maximized therapeutic benefit while minimizing risks. The preparation of medicinal foods was a sophisticated art. Indigenous cooks knew how to prepare foods to maximize their therapeutic value. They understood which cooking methods preserved medicinal compounds and which ones destroyed them. They knew how to combine different foods to create synergistic effects that enhanced healing. The seasonal eating practices of indigenous peoples were based on sophisticated understanding of nutrition and health maintenance. They ate different foods at different times of the year to maintain optimal health. Spring foods helped cleanse the body after winter. Summer foods provided energy for active seasons. Fall foods prepared the body for winter. Winter foods sustained health during the cold season. The use of fermented foods in indigenous diets provided important probiotics that supported digestive and immune health. Many tribes had developed fermented meat, vegetable, and grain preparations that provided beneficial bacteria. They understood that these foods were important for maintaining digestive health and preventing certain types of illness. The treatment of women's health issues was particularly advanced in indigenous medicine. Female healers had developed sophisticated understanding of reproductive health, pregnancy, and childbirth. They had effective treatments for menstrual problems, fertility issues, and pregnancy complications. They understood the importance of proper nutrition during pregnancy and had developed specific dietary recommendations for pregnant women. Midwifery practices among indigenous peoples were remarkably advanced. Indigenous midwives had developed techniques for managing difficult births that weren't matched by European medicine for centuries. They understood fetal positioning and had developed methods for correcting problematic presentations. They knew how to manage bleeding complications and other birth emergencies. The treatment of children's health issues was based on understanding that children were not just small adults, but had unique medical needs. Indigenous healers had developed specific treatments for childhood diseases and had created child-friendly preparations of medicinal plants. They understood that dosing needed to be adjusted for children and had developed safe pediatric protocols. Elder care in indigenous communities was comprehensive and sophisticated. Healers understood the specific health challenges faced by elderly people and had developed treatments for age-related conditions. They recognized that older people often had multiple health problems that required coordinated treatment approaches. They understood the importance of maintaining dignity and quality of life for elderly community members. The treatment of mental health conditions was particularly advanced in indigenous medicine. Healers understood that mental and emotional problems were real medical conditions that required specific treatments. They had developed various therapeutic approaches, including counseling, ceremony, and plant medicines for treating depression, anxiety, and other mental health conditions. The use of psychedelic plants in therapeutic settings was carefully controlled and supervised by experienced healers. These powerful medicines were used to treat various mental health conditions, including depression, anxiety, and trauma. The therapeutic use of these plants was always conducted within ceremonial contexts, that provided safety and support for patients undergoing treatment. Community-based healing approaches were central to indigenous medicine. Healers understood that individual health was connected to community health and that healing often required community involvement. They had developed various group healing ceremonies and community support systems that promoted both individual and collective health. The integration of all these different aspects of indigenous medicine created comprehensive healthcare systems that addressed every aspect of human health and well-being. These weren't primitive medical practices, but sophisticated healing traditions that understood the complex interconnections between physical, mental, emotional, spiritual, and social health. The legacy of indigenous American medicine continues to influence modern healthcare in profound ways. The holistic approach to health that characterized indigenous medicine is now being recognized as essential for effective healthcare delivery. The understanding that health is determined by multiple factors, including nutrition, exercise, social support, and spiritual well-being, is becoming mainstream in modern medicine. The plant medicines discovered and developed by indigenous peoples continue to be sources of new pharmaceutical compounds. Researchers are actively studying traditional medicinal plants to identify new treatments for cancer, infectious diseases, and other modern health challenges. The botanical knowledge of indigenous peoples represents a vast, untapped resource for future medical discoveries. The surgical techniques developed by indigenous peoples influence the development of modern surgery in ways that are often unrecognized. The precision and effectiveness of indigenous surgical procedures demonstrated that complex surgery was possible without modern technology and inspired later developments in surgical technique. The diagnostic methods used by indigenous healers are being studied and sometimes adopted by modern practitioners. The pulse diagnosis techniques of indigenous peoples are being investigated for their potential applications in modern medicine. The holistic diagnostic approach that considers multiple factors in assessing health is becoming more common in contemporary healthcare. The ceremonial aspects of indigenous medicine reveal layers of therapeutic sophistication that modern healthcare is only beginning to understand. These weren't just religious rituals performed alongside medical treatment. They were integral components of healing that addressed psychological trauma, social dysfunction, and spiritual imbalance in ways that enhance physical recovery. The talking circle, used by many plains and woodland tribes, functioned as sophisticated group therapy that helped individuals process traumatic experiences while strengthening community bonds. Participants shared their struggles and received support from community members who had faced similar challenges. This collective healing approach recognized that individual trauma affected entire communities and that healing needed to address both personal and social wounds. The healing lodge ceremonies, practiced by various tribes, created controlled therapeutic environments where patients could recover from serious illnesses while receiving intensive community support. These weren't primitive hospital wards, but carefully designed healing spaces that optimized recovery through environmental factors, social support, and spiritual intervention. Dream interpretation played a crucial role in indigenous diagnostic medicine. Healers understood that dreams often revealed important information about a patient's psychological state and potential health problems. They had developed sophisticated systems for interpreting dream symbols and using dream content to guide treatment decisions. This represented an early form of psychological assessment that recognized the connection between mental and physical health. The use of storytelling as therapeutic intervention was remarkably advanced. Indigenous healers used carefully crafted stories to help patients understand their illnesses, cope with difficult treatments, and maintain hope during recovery. These therapeutic stories weren't just entertainment, but precisely designed psychological interventions that promoted healing through meaning-making and emotional processing. Art therapy was extensively used in indigenous healing practices. Patients created paintings, sculptures, and other artistic works as part of their treatment. Healers understood that creative expression could help process trauma, reduce stress, and promote emotional healing. Sand painting ceremonies among southwestern tribes served both artistic and therapeutic functions, creating beautiful works of art while providing healing benefits for participants. Music therapy was central to many indigenous healing traditions. Different rhythms, melodies, and instruments were used to achieve specific therapeutic effects. Drumming was used to induce trance states that facilitated healing. Flute music was used for relaxation and pain relief. Singing was used to strengthen community bonds and provide emotional support for healing individuals. The seasonal ceremony cycles practiced by many tribes provided year-round health maintenance that prevented many illnesses before they could develop. Spring renewal ceremonies helped community members transition from winter isolation to summer activity. Harvest ceremonies gave thanks for abundance while preparing mentally and spiritually for winter challenges. These ceremonial cycles maintained psychological and social health throughout the year. The Vision Quest tradition represents one of the most sophisticated psychological interventions ever developed. This rite of passage combined controlled stress exposure, sensory deprivation, social isolation, and spiritual seeking to promote psychological growth and resilience. Participants emerged from Vision Quests with enhanced self-confidence, clearer life direction, and stronger cultural identity. Modern wilderness therapy programs have adopted many Vision Quest principles for treating psychological disorders. The Sweat Lodge ceremony functioned as comprehensive therapeutic intervention that addressed multiple health needs simultaneously. The heat and humidity helped with respiratory conditions and detoxification. The group participation provided social support and stress relief. The ceremonial structure gave meaning to suffering and promoted psychological healing. The physical purification represented spiritual renewal and emotional cleansing. Indigenous healers understood that grief and loss could cause serious physical illness if not properly processed. They had developed sophisticated grief counseling techniques that helped individuals and communities cope with death, trauma, and major life changes. Mourning ceremonies provided structured ways to express grief while receiving community support during difficult times. The naming ceremonies practiced by many tribes served important psychological and social functions. Names weren't just labels, but carried spiritual power and cultural meaning that shaped individual identity and community relationships. Healing ceremonies sometimes included name changes that represented transformation and renewal, helping patients develop new identities as healthy individuals rather than sick people. The age-grade societies found in many indigenous communities provided structured social support that promoted health and well-being throughout the lifespan. Children's societies taught health knowledge and life skills. Adult societies provided mutual support and shared responsibility for community health. Elder societies preserved medical knowledge while providing wisdom and guidance to younger healers. The trading partnerships between different tribes created extensive networks for sharing medical knowledge and obtaining rare medicinal plants. These relationships weren't just commercial, but represented sophisticated information exchange systems that continuously improved medical practice across vast geographic areas. Healers would travel hundreds of miles to learn new techniques or obtain specific medicines for their communities. The botanical gardens maintained by many tribes served as living pharmacies that ensured reliable access to medicinal plants. These weren't wild collection areas, but carefully tended cultivation sites where healers grew, bred, and improved medicinal plants. Some tribes developed varieties of medicinal plants with enhanced therapeutic properties through selective cultivation over many generations. The preservation techniques used for medicinal plants were remarkably sophisticated. Indigenous peoples had developed methods for drying, fermenting, and storing plant medicines that maintained their potency for years. They understood which preservation methods worked best for different types of plant compounds and had created storage systems that protected medicines from moisture, insects, and degradation. The quality control systems used by indigenous healers ensured that plant medicines met consistent standards for purity and potency. Healers could identify adulterated or contaminated plant medicines through careful examination of color, smell, texture, and taste. They had developed testing methods that revealed whether plants had been harvested at the right time and properly prepared. The dosing systems used in indigenous medicine were remarkably precise. Healers had developed various measurement techniques that allowed for accurate dosing of powerful plant medicines. They understood that therapeutic effects depended on precise dosing and had created systems for adjusting doses based on patient size, age, condition, and sensitivity. And the timing protocols for medicine administration were based on sophisticated understanding of how human physiology varied throughout the day and year. Healers knew which medicines worked best at different times of day and had developed detailed schedules for medicine administration that maximized therapeutic effects while minimizing side effects. The food and medicine interactions were well understood by indigenous healers. They knew which foods enhanced the effects of plant medicines and which ones interfered with therapeutic activity. They had developed detailed dietary recommendations that patients needed to follow while taking certain medicines to ensure optimal treatment outcomes. The contraindications and warnings associated with plant medicines were carefully preserved in healing traditions. Healers knew which medicines should not be used during pregnancy, which ones were dangerous for children, and which combinations of plants could cause harmful interactions. This safety knowledge was rigorously taught to healing apprentices and strictly observed in medical practice. The individual sensitivity testing performed by indigenous healers helped identify patients who might have adverse reactions to certain plant medicines. Healers would start with very small doses and carefully observe patient responses before proceeding with full therapeutic doses. They understood that individual responses to medicines could vary significantly and had developed protocols for safe medicine administration. The monitoring systems used during treatment allowed healers to track patient progress and adjust treatments as needed. They carefully observed changes in symptoms, side effects, and overall patient condition throughout the treatment process. This continuous monitoring ensured that treatments remained safe and effective, while allowing for modifications based on patient response. The treatment outcome documentation, though often oral rather than written, was remarkably detailed and comprehensive. Healers maintained careful records of which treatments worked for different conditions, which patients responded best to various approaches, and which complications could arise during treatment. This information was preserved and transmitted through generations of medical training. The research and development activities conducted by indigenous healers represented sophisticated medical investigation that continuously improved treatment methods. Healers would experiment with new plant combinations, test different preparation methods, and develop innovative treatment approaches based on careful observation and analysis of treatment outcomes. The medical education systems used by indigenous peoples were comprehensive and rigorous. Healing apprentices underwent years of training that included botanical identification, plant preparation, diagnostic techniques, treatment protocols, ceremonial knowledge, and ethical standards. The training was both theoretical and practical, with extensive hands-on experience under the supervision of master healers. The specialization systems within indigenous medicine allowed healers to develop expertise in specific areas of medical practice. Some healers specialized in surgery, others in obstetrics, others in mental health, and others in specific diseases or patient populations. This specialization improved treatment outcomes by allowing healers to focus their expertise on particular medical areas. The consultation networks between healers provided ways to obtain second opinions and collaborative treatment approaches for difficult cases. Healers would consult with colleagues when faced with challenging patients or unusual conditions. These consultation systems ensured that patients received the best possible care while providing continuing education opportunities for healers. The ethical standards maintained by indigenous healers were strict and comprehensive. Healers were expected to put patient welfare above personal gain, maintain confidentiality, practice within their areas of competence, and continuously improve their knowledge and skills. These ethical principles were enforced by healing societies and community oversight. The integration of indigenous medicine with environmental stewardship created sustainable healthcare systems that could operate indefinitely without depleting natural resources. Healers understood that overharvesting medicinal plants could threaten both plant populations and future medical practice. They had developed sustainable harvesting protocols that ensured long-term availability of medicinal plants. The conservation practices used by indigenous peoples protected medicinal plant habitats and maintained biodiversity that was essential for comprehensive medical practice. They understood that healthy ecosystems were necessary for healthy human communities and had developed land management practices that supported both environmental and human health. The climate adaptation strategies developed by indigenous peoples allowed medical practices to continue effectively despite environmental changes. They understood how weather patterns affected plant medicine availability and had developed alternative sources and backup plans for maintaining medical care during difficult environmental conditions. The disaster preparedness systems used by indigenous communities ensured that medical care could continue during emergencies, wars, and natural disasters. They maintained emergency medicine supplies, developed mobile treatment capabilities, and created mutual aid networks that provided medical support during crises. The international exchange systems used by indigenous peoples facilitated the sharing of medical knowledge across vast distances and different cultural groups. Medical innovations developed in one region could spread throughout the Americas through these exchange networks, creating continental medical traditions that incorporated the best knowledge from multiple cultures. The documentation and preservation of medical knowledge was accomplished through sophisticated oral tradition systems that maintained accuracy and completeness across generations. Master healers used songs, stories, and ceremonies to encode medical information in memorable formats that could be accurately transmitted without written records. The validation and verification systems used by indigenous peoples ensured that medical knowledge remained accurate and effective over time. New healing apprentices were required to demonstrate their knowledge and skills before being allowed to practice independently. Experienced healers regularly reviewed and updated medical protocols based on new observations and experiences. The innovation and adaptation processes used by indigenous peoples allowed medical traditions to continuously improve and evolve. Healers were encouraged to develop new techniques and approaches while maintaining respect for traditional knowledge. This balance between innovation and tradition kept indigenous medicine current and effective while preserving valuable historical knowledge. The standardization systems used by indigenous peoples ensured that medical practices remained consistent and reliable across different healers and communities. While individual healers might have personal specialties and preferences, core medical knowledge and practices were standardized through extensive training and community oversight. The mentorship programs used in indigenous medical education created strong relationships between master healers and apprentices that ensured comprehensive knowledge transfer. These relationships often lasted for decades and included not just medical training, but personal development and spiritual guidance that prepared healers for their demanding roles in community health. The continuing education systems used by indigenous healers ensured that medical knowledge remained current and comprehensive throughout their careers. Healers regularly attended ceremonies, conferences, and training sessions where they shared knowledge, learned new techniques, and updated their understanding of medical practice. The peer review systems used by indigenous healers provided quality assurance and professional accountability that maintained high standards of medical practice. Healers regularly observed each other's work, discussed difficult cases, and provided feedback that improved treatment outcomes and professional development. The community oversight systems used by indigenous peoples ensured that healers remained accountable to the communities they served. Community leaders and elder councils provided supervision and guidance that kept healers focused on community welfare rather than personal gain. The integration of all these systems created comprehensive healthcare networks that provided effective medical care for indigenous communities across the Americas. These networks demonstrated that sophisticated healthcare systems could be developed and maintained without modern technology or centralized institutions. The legacy systems used by indigenous peoples ensured that medical knowledge would be preserved and transmitted to future generations. Master healers took responsibility for training successors and preserving medical traditions that had been developed over thousands of years of careful observation and practice. The cultural preservation efforts of indigenous peoples protected not just medical knowledge, but the cultural contexts that made that knowledge effective. They understood that medicine couldn't be separated from culture and worked to maintain the languages, ceremonies, and social structures that supported effective healing practice. The adaptation strategies developed by indigenous peoples allowed traditional medical knowledge to remain relevant and effective in changing circumstances. They found ways to maintain traditional practices while adapting to new environments, new diseases, and new social conditions. The resilience demonstrated by indigenous medical traditions throughout centuries of disruption and persecution speaks to their fundamental effectiveness and importance. Despite enormous challenges, many indigenous healing traditions have survived and continue to provide valuable medical knowledge that benefits not just indigenous communities, but all of humanity. The scientific validation of indigenous medical knowledge through modern research continues to confirm the effectiveness of traditional healing practices. Researchers are discovering that many traditional treatments have solid scientific foundations, and that indigenous diagnostic and treatment methods often achieve results that match or exceed modern medical approaches. The integration opportunities between indigenous and modern medicine are creating new possibilities for more effective and holistic healthcare. Medical schools are beginning to include traditional healing knowledge in their curricula, and healthcare systems are exploring ways to incorporate indigenous healing practices into conventional medical care. The intellectual property protections being developed for indigenous medical knowledge help ensure that traditional healers and communities receive appropriate recognition and compensation for their contributions to medical knowledge. These protections are essential for maintaining indigenous healing traditions while respecting the rights of the people who developed this knowledge. The future potential of indigenous medical knowledge remains enormous. As modern medicine grapples with complex challenges like antibiotic resistance, chronic disease, and mental health epidemics, the holistic and sustainable approaches developed by indigenous peoples offer valuable solutions and alternatives. The global relevance of indigenous medical knowledge extends far beyond specific treatments or techniques. The fundamental principles of indigenous medicine, including holistic health approaches, sustainable resource use, community-based care, and integration of physical and spiritual healing, offer models for developing more effective and humane healthcare systems worldwide. The continuing research into indigenous medical knowledge promises to yield new discoveries that will benefit all of humanity. The vast botanical pharmacopoeia developed by indigenous peoples represents an untapped resource for developing new treatments for modern diseases. The diagnostic and treatment approaches developed by traditional healers offer alternatives to conventional medical practice that may be more effective for certain conditions. The educational value of studying indigenous medical knowledge extends beyond specific medical applications. These traditions demonstrate the importance of careful observation, systematic thinking, and holistic approaches to complex problems. They show how human communities can develop sophisticated knowledge systems without formal scientific institutions. The inspiration provided by indigenous medical traditions encourages modern practitioners to think more creatively and comprehensively about health and healing. The remarkable achievements of traditional healers demonstrate that effective medicine can take many different forms, and that conventional medical practice doesn't represent the only valid approach to healthcare. The wisdom embedded in indigenous medical traditions offers guidance for developing more sustainable and equitable healthcare systems. These traditions show how medical knowledge can be preserved and transmitted across generations. How communities can take responsibility for their own health, and how healthcare can be integrated with other aspects of cultural and social life. Cultural and social life. And social life. The preservation of indigenous medical knowledge represents one of the most remarkable achievements in human history. But it's a story that goes far beyond simple plant identification or surgical technique. What we're really looking at is the development of comprehensive healthcare systems that understood something modern medicine is only beginning to grasp. That health isn't just about fixing what's broken. It's about maintaining balance in complex, interconnected systems. The seasonal medicine wheels used by many plains and southwestern tribes weren't just calendars. They were sophisticated medical planning tools that coordinated healthcare activities with natural cycles throughout the year. These wheels mapped out when specific plants would be at peak potency, when certain health conditions were most likely to occur, and when particular therapeutic interventions would be most effective. Spring medicine focused on detoxification and renewal. Healers knew that winter's end brought specific health challenges as bodies adjusted to changing light, temperature, and activity levels. They had developed comprehensive spring cleansing protocols using plants like dandelion root for liver detoxification, nettle for blood purification, and various bitter herbs to stimulate digestive function after months of heavy winter foods. Summer medicine emphasized prevention and maintenance. With abundant plant medicines available and communities most active, this was the time for building immunity, treating chronic conditions, and preparing for the challenges ahead. Healers would gather and process the majority of their annual plant medicine supplies during summer months when active compounds were at their highest concentrations. Fall medicine prepared bodies and communities for winter survival. This involved not just physical preparation through specific foods and medicines, but psychological and spiritual preparation for the isolation and challenges of cold seasons. Fall ceremonies helped individuals and communities process the year's experiences while building resilience for winter hardships. Winter medicine focused on maintenance and healing during the season when fresh plant medicines were least available. Healers relied on carefully preserved medicines and emphasized treatments that could be sustained with limited resources. Winter was also the primary time for serious healing ceremonies that required extended periods of rest and community support. The geographic medicine traditions developed by different tribes created specialized knowledge systems perfectly adapted to specific environments. Arctic peoples became masters of treating cold-related injuries and maintaining health in extreme conditions. Desert tribes developed unparalleled knowledge of drought-resistant medicinal plants and heat-related illness treatment. Coastal peoples created sophisticated marine-based medicine systems using seaweeds, fish oils, and other ocean resources. Mountain medicine traditions were particularly advanced in treating altitude-related health problems and injuries from steep terrain. High-altitude peoples developed unique understanding of how thin air affected human physiology and created specific treatments for altitude sickness, enhanced healing protocols for the slower recovery that occurred at high elevations, and specialized respiratory treatments for the breathing challenges of mountain environments. River Valley peoples developed medicine systems focused on the unique health opportunities and challenges of living near major waterways. They became experts in treating water-related illnesses, using river plants for medicine, and managing the seasonal health changes that came with flooding and drought cycles. Their knowledge of fish-based medicines and water purification techniques was particularly sophisticated. Prairie medicine traditions emphasized treatments for the health challenges of open grassland living. Wind, extreme weather variations, and the nomadic lifestyle required by following animal migrations created specific health needs that prairie peoples addressed through portable medicine systems and treatments adapted to constant movement. Forest medicine traditions developed the most diverse botanical knowledge systems because of the incredible plant diversity of woodland environments. Forest peoples became masters of tree-based medicines, mushroom and fungi treatments, and the complex ecosystem interactions that affected both plant medicine quality and human health in heavily wooded areas. The diagnostic integration practiced by indigenous healers combined multiple assessment methods to create comprehensive understanding of patient health status. They didn't rely on single diagnostic indicators, but developed systematic approaches that evaluated physical, emotional, spiritual, and social factors simultaneously to understand the complete health picture. Physical diagnosis included detailed examination of pulse patterns, breathing rhythms, skin color and texture, eye clarity and movement, tongue appearance, body odors, urine characteristics, and overall energy levels. Each of these diagnostic indicators provided specific information about different body systems and potential health problems. Emotional diagnosis assessed mood patterns, stress levels, grief processing, anger management, fear responses, and social relationship quality. Indigenous healers understood that emotional imbalances could cause physical illness and that successful treatment required addressing emotional as well as physical symptoms. Spiritual diagnosis evaluated the patient's connection to cultural traditions, ceremonial participation, dream patterns, vision experiences, and overall sense of life purpose and meaning. Spiritual imbalance was understood to be a major cause of illness that required specific spiritual treatments alongside physical interventions. Social diagnosis examined family relationships, community connections, work satisfaction, tribal role fulfillment, and overall social support systems. Indigenous healers recognized that social isolation and conflict could cause serious health problems, and that healing often required addressing social as well as individual issues. Environmental diagnosis considered seasonal factors, weather influences, geographic location effects, and exposure to natural and human-made hazards. Healers understood that environmental factors significantly influenced health, and that successful treatment required addressing environmental as well as personal causes of illness. The treatment integration practiced by indigenous healers created comprehensive therapeutic protocols that addressed all identified causes of illness simultaneously. Rather than treating symptoms in isolation, they developed treatment plans that coordinated multiple interventions to address the complex factors contributing to health problems. Botanical medicine was carefully coordinated with dietary therapy to ensure that plant medicines and therapeutic foods worked together synergistically. Healers knew which foods enhanced the effects of specific plant medicines and which foods might interfere with treatment effectiveness. Physical therapy was integrated with ceremonial healing to address both the mechanical and spiritual aspects of injury recovery. Patients didn't just receive exercises to restore physical function, but participated in ceremonies that helped them process the emotional and spiritual trauma associated with their injuries. Surgical interventions were combined with extensive pre- and post-operative spiritual preparation that helped patients psychologically prepare for procedures while mobilizing community support for recovery. Surgery wasn't just a physical intervention, but a community event that involved extensive ceremonial and social components. Mental health treatments integrated individual counseling with group therapy and community involvement to address the social as well as personal aspects of psychological problems. Indigenous healers understood that mental health problems often reflected community dysfunction, as well as individual issues, and developed treatments that address both levels simultaneously. The therapeutic timing systems used by indigenous healers optimized treatment effectiveness by coordinating interventions with natural biological and environmental rhythms. They understood that the effectiveness of treatments varied depending on when they were administered, and had developed sophisticated scheduling systems that maximized therapeutic benefits. Daily rhythm medicine recognized that human physiology varied throughout the day, and that different treatments were most effective at different times. Morning treatments focused on energizing and activating the body. Midday treatments emphasized strength and active healing. Evening treatments promoted relaxation and recovery. Night treatments supported rest and regeneration. Monthly rhythm medicine coordinated treatments with lunar cycles that were understood to influence human physiology. particularly for women's reproductive health. Different phases of the moon were associated with different types of healing energy, and treatments were timed to take advantage of these natural cycles. Seasonal rhythm medicine aligned treatments with the major environmental cycles that affected human health throughout the year. Spring treatments focused on renewal and detoxification. Summer treatments emphasized building and strengthening. Fall treatments prepared for winter challenges. Winter treatments maintained health during the most difficult season. Life cycle rhythm medicine recognized that human health needs change dramatically throughout the lifespan, and that treatments needed to be adapted for different age groups. Childhood medicine focused on growth and development support. Adult medicine emphasized strength and reproductive health. Elder medicine prioritized comfort and dignity while managing age-related health challenges. The community healing systems developed by indigenous peoples created healthcare networks that provided comprehensive medical support for entire populations. These weren't just collections of individual healers, but integrated systems that coordinated care across multiple levels and specialties. Family medicine provided basic healthcare within extended family groups, where family members learned essential medical skills that allowed them to handle routine health problems and provide initial treatment for more serious conditions. This distributed basic medical knowledge throughout the community and ensured that medical care was available even when specialized healers weren't present. Specialist medicine provided advanced care for complex conditions that required specialized knowledge and training. Different healers specialized in surgery, obstetrics, pediatrics, mental health, or specific diseases, creating networks of medical expertise that could address any health problem that might arise in the community. Emergency medicine systems provided rapid response capabilities for accidents, injuries, and acute illnesses that required immediate intervention. These systems included trained emergency responders, portable medical kits, and transportation networks that could quickly move patients to appropriate care providers. Preventive medicine programs provided community-wide health maintenance activities that prevented illness and promoted wellness for entire populations. These programs included vaccination campaigns, health education, environmental health measures, and lifestyle interventions that kept communities healthy, rather than just treating them when they became sick. Rehabilitation medicine systems provided long-term care for individuals recovering from serious injuries or illnesses. These systems included physical therapy, occupational therapy, psychological support, and social reintegration programs that helped patients return to full participation in community life. The medical research systems developed by indigenous peoples created mechanisms for continuously improving medical knowledge and practice. These research systems were based on careful observation, systematic experimentation, and rigorous evaluation of treatment outcomes over long periods of time. Clinical observation systems provided structured methods for monitoring patient responses to different treatments and identifying factors that influenced treatment effectiveness. Healers maintained detailed mental records of which treatments worked best for different conditions and which factors predicted successful outcomes. Experimental protocols allowed healers to test new treatments and modifications to existing protocols in safe and systematic ways. New treatments were carefully evaluated using small groups of volunteers before being adopted for general use, ensuring that innovations were both safe and effective. Outcome measurement systems provided ways to evaluate the long-term effectiveness of different treatments and identify areas where improvements were needed. Healers tracked patient recovery rates, complication frequencies, and long-term health outcomes to continuously refine their treatment approaches. Knowledge validation systems ensured that medical knowledge remained accurate and reliable over time. New discoveries were carefully evaluated by experienced healers before being incorporated into standard practice, and existing knowledge was regularly reviewed and updated based on new observations and experiences. Information sharing systems facilitated the exchange of medical knowledge between different healers and communities. These systems included formal conferences, apprenticeship exchanges, and trading relationships that allowed medical innovations to spread throughout indigenous healthcare networks. The quality assurance systems used by indigenous healthcare providers maintained high standards of medical practice while ensuring patient safety. These systems included training requirements, practice oversight, and accountability measures that protected patients while supporting professional development. Training standardization ensured that all healers received comprehensive education in essential medical knowledge and skills. While individual healers might develop personal specialties, all were required to master core competencies in diagnosis, treatment, and patient care before being allowed to practice independently. Practice monitoring provided ongoing supervision of healer performance to identify areas where additional training might be needed and ensure that patient care remained at the highest possible level. Experienced healers regularly observed and evaluated the work of less experienced colleagues, providing feedback and guidance that improved overall practice quality. Patient safety protocols protected patients from potential harm while ensuring that treatments remained effective. These protocols included contraindication screening, adverse reaction monitoring, and emergency response procedures that minimized treatment risks while maximizing benefits. Ethical enforcement systems maintained professional standards and ensured that healers remained focused on patient welfare rather than personal gain. These systems included codes of conduct, disciplinary procedures, and community oversight that held healers accountable for their professional behavior. Continuous improvement processes ensured that medical practice continued to evolve and improve over time. These processes included regular review of treatment outcomes, incorporation of new knowledge and techniques, and adaptation to changing health needs and environmental conditions. The technological innovations developed by indigenous peoples created medical tools and techniques that were remarkably advanced for their time. These innovations demonstrate the practical engineering skills and scientific understanding that characterized indigenous medical practice. Surgical instrument development produced specialized tools that were precisely designed for specific medical procedures. These instruments were often superior to European tools of the same period and demonstrated sophisticated understanding of surgical principles and metallurgy. Drug delivery systems created innovative methods for administering plant medicines in ways that maximize therapeutic effectiveness while minimizing side effects. These systems included various types of syringes, inhalation devices, and topical application methods that delivered medicines exactly where they were needed. Diagnostic equipment development produced tools that enhanced the healer's ability to assess patient condition and monitor treatment progress. These tools included various types of examination instruments, measurement devices, and monitoring equipment that improved diagnostic accuracy. Treatment devices created specialized equipment for providing specific types of therapy. These devices included traction equipment for orthopedic treatment, hydrotherapy apparatus for water-based treatments, and various types of therapeutic devices that enhanced treatment effectiveness. Preservation technology developed methods for maintaining the quality and potency of plant medicines over extended periods. These technologies included sophisticated drying, fermentation, and storage techniques that preserved medicinal compounds while preventing degradation and contamination. The educational systems used by indigenous peoples created comprehensive medical training programs that produced highly skilled healthcare providers. These educational systems were based on apprenticeship models that combined theoretical knowledge with extensive practical experience under expert supervision. Curriculum development created structured learning programs that ensured comprehensive coverage of essential medical knowledge and skills. These curricula included botanical identification, plant preparation, diagnostic techniques, treatment protocols, surgical procedures, and professional ethics. Teaching methodology development produced effective instructional techniques that facilitated knowledge transfer and skill development. These methodologies included hands-on practice, case-based learning, mentorship relationships, and ceremonial instruction that enhanced both learning effectiveness and cultural transmission. Assessment systems provided methods for evaluating student progress and ensuring that graduates possess the knowledge and skills necessary for independent practice. These assessments included practical examinations case presentations, and community evaluation that validated healer competency. Continuing education systems provided ongoing learning opportunities that allowed practicing healers to maintain current knowledge and develop new skills throughout their careers. These systems included advanced training programs, specialty workshops, and peer learning networks that supported professional development. Knowledge preservation systems ensured that medical knowledge was accurately maintained and transmitted across generations. These systems included sophisticated memorization techniques, oral tradition protocols, and ceremonial knowledge transfer that preserved essential medical information without written records. The integration of indigenous medical knowledge with modern healthcare continues to offer opportunities for improving contemporary medical practice. The holistic approaches, sustainable practices, and community-based care models developed by indigenous peoples provide valuable alternatives to conventional medical approaches that often focus too narrowly on specific diseases or body systems. Research collaboration between indigenous healers and modern medical researchers is producing new insights into effective healthcare delivery that combines the best aspects of traditional and modern approaches. These collaborations are discovering that many traditional practices have solid scientific foundations, and that indigenous diagnostic and treatment methods often achieve better outcomes than conventional approaches alone. Medical education integration is beginning to include traditional healing knowledge in modern medical curricula, exposing future healthcare providers to holistic approaches and alternative treatment methods that can enhance their effectiveness as healers. This integration helps bridge the gap between traditional and modern medicine, while preserving valuable indigenous knowledge. Healthcare system integration is exploring ways to incorporate traditional healing practices into modern healthcare delivery systems, creating more comprehensive and culturally appropriate care options. These integration efforts are particularly important for indigenous communities, but also offer benefits for broader populations seeking more holistic healthcare approaches. Policy development is creating frameworks that support the preservation and appropriate use of traditional medical knowledge, while protecting the rights of indigenous peoples who develop this knowledge. These policies are essential for ensuring that traditional healing knowledge remains available for future generations while respecting cultural ownership and intellectual property rights. The global impact of indigenous American medical knowledge extends far beyond the Americas and continues to influence healthcare development worldwide. The principles and practices developed by indigenous peoples offer models for creating more effective, sustainable, and humane healthcare systems that serve all of humanity. International recognition of traditional medical knowledge is growing as healthcare systems worldwide grapple with complex challenges that require innovative solutions. The World Health Organization and other international organizations are increasingly acknowledging the value of traditional medicine and working to integrate traditional knowledge into global health strategies. Cross-cultural medical exchange is facilitating the sharing of traditional healing knowledge between different indigenous cultures and between traditional and modern medical systems. These exchanges are creating new opportunities for medical innovation and improving healthcare outcomes for diverse populations worldwide. Sustainable healthcare development is adopting principles from indigenous medicine to create healthcare systems that can operate effectively without depleting natural resources or creating environmental damage. These approaches are particularly important as healthcare systems worldwide face sustainability challenges. Global health equity initiatives are incorporating lessons from indigenous community-based healthcare models to improve access to quality healthcare for underserved populations. The community-centered approaches developed by indigenous peoples offer valuable strategies for addressing healthcare disparities and improving health outcomes for marginalized communities. The future potential of indigenous medical knowledge remains vast and largely untapped. As modern healthcare faces increasingly complex challenges including antibiotic resistance, chronic disease epidemics, and mental health crises, The comprehensive approaches developed by indigenous peoples offer valuable resources for developing innovative solutions. Pharmaceutical development continues to discover new therapeutic compounds in plants that indigenous peoples have used medicinally for thousands of years. The botanical knowledge of indigenous peoples represents an enormous resource for developing new treatments for modern diseases. But this development must be conducted in ways that respect indigenous rights and provide appropriate benefits to the communities that preserved this knowledge. Diagnostic innovation is exploring traditional assessment methods that may offer advantages over modern diagnostic techniques for certain conditions. The holistic diagnostic approaches used by indigenous healers often detect health problems that conventional medicine misses and may provide more effective ways to assess overall health status. Treatment innovation is investigating traditional therapeutic approaches that may be more effective than modern treatments for certain conditions. The comprehensive treatment protocols used by indigenous healers often achieve better outcomes than conventional approaches and may offer alternatives for patients who don't respond well to modern treatments. Healthcare delivery innovation is adopting community-based care models developed by indigenous peoples to improve healthcare access and effectiveness. These models may be particularly valuable for rural and underserved communities where conventional healthcare delivery systems are inadequate. Prevention innovation is incorporating traditional health maintenance approaches into modern preventive medicine programs. The lifestyle and environmental approaches developed by indigenous peoples offer valuable strategies for preventing illness and maintaining health throughout the lifespan. The wisdom embedded in indigenous medical traditions offers profound lessons about the nature of health, healing, and human well-being that extend far beyond specific medical techniques or treatments. These traditions demonstrate that effective healthcare requires understanding the complex interconnections between individual and community health, between physical and spiritual well-being, and between human health and environmental sustainability. The legacy of indigenous American medicine continues to inspire and guide healthcare development worldwide, offering hope for creating more effective, compassionate, and sustainable approaches to healing that serve all of humanity while honoring the wisdom of the peoples who first developed these remarkable medical traditions thousands of years ago. The complexity of indigenous medical knowledge becomes even more striking when you examine how these healing traditions adapted to catastrophic events and survived through periods of massive disruption. When European diseases swept through native populations in the 1500s and 1600s, traditional healers didn't simply abandon their practices. Instead, they rapidly developed new treatment protocols for unfamiliar illnesses while maintaining their core medical principles. Cherokee healers, facing smallpox outbreaks that had no precedent in their medical tradition, quickly identified plant combinations that could reduce fever and support immune function during viral infections. They adapted their existing knowledge of fever-reducing plants like willow bark and combined them with immune-supporting herbs like echinacea to create new treatment protocols for European diseases. The Ojibwe people, confronted with tuberculosis spreading through their communities, developed comprehensive treatment approaches that combined traditional lung-supporting plants with innovative social isolation protocols that limited disease transmission. They understood contagion principles and implemented quarantine measures that were remarkably effective given their limited understanding of bacterial transmission. What made this adaptive capacity possible was the underlying flexibility built into indigenous medical systems. Rather than rigid protocols that couldn't be modified, these healing traditions were based on principles that could be applied to new situations. Healers understood the fundamental concepts of supporting immune function, reducing inflammation, managing pain, and promoting healing. When faced with new diseases, they could apply these principles using available plant medicines and treatment methods. The documentation of medical knowledge through artistic expression reveals another layer of sophistication in indigenous healthcare systems. Many tribes created intricate pictographic records of medicinal plants, treatment protocols, and healing ceremonies that served as visual medical texts for future generations. These weren't primitive drawings, but sophisticated information storage systems that encoded complex medical knowledge in memorable visual formats. Navajo sand paintings contain detailed information about specific healing ceremonies, including which plants to use, how to prepare them, and the precise sequence of ritual actions needed for effective treatment. These temporary artworks served as both ceremonial tools and medical reference guides that preserved essential healing knowledge. Lakota winter counts included pictographic records of major health events, epidemic diseases, and successful healing interventions that provided historical medical data for future healers. These visual chronicles helped healers understand disease patterns, track the effectiveness of treatments over time, and prepare for recurring health challenges. Northwest Coast totem poles and house posts contained encoded information about family medical histories, hereditary health conditions, and clan-specific healing knowledge that was passed down through generations. These monumental artworks served as permanent medical records that preserved essential health information for entire family lineages. The mathematical precision underlying indigenous medicine reveals sophisticated quantitative thinking that guided everything from dosing calculations to treatment timing. Traditional healers had developed complex mathematical systems for determining optimal doses of plant medicines based on patient weight, age, condition severity, and seasonal factors. Mayan healers used advanced astronomical calculations to determine optimal timing for medical treatments based on lunar cycles, planetary positions, and seasonal changes. They understood that human physiology varied in predictable patterns that could be calculated and used to enhance treatment effectiveness. Incan healers developed precise measurement systems for surgical procedures that allowed them to perform complex operations with remarkable accuracy. They used standardized units of measurement for determining incision depths, calculating tissue removal amounts, and planning surgical approaches that minimize trauma while maximizing therapeutic benefit. The pharmacological sophistication of indigenous plant preparation methods demonstrates advanced understanding of chemistry and biochemistry that predates modern pharmaceutical science by centuries. Traditional healers knew how to extract, concentrate, and modify plant compounds to create medicines with specific therapeutic properties. Fermentation techniques used by various tribes created probiotic medicines that supported digestive health and immune function. These fermented plant preparations contained beneficial bacteria and enhanced bioactive compounds that were more effective than the raw plants alone. Distillation methods developed by some tribes allowed them to create concentrated plant essences with enhanced therapeutic potency. These concentrated preparations could be stored for long periods and provided powerful medicines that were particularly valuable during times when fresh plants weren't available. Combination chemistry principles guided the mixing of different plant medicines to create synergistic effects that were more powerful than individual plants used alone. Traditional healers understood which plant compounds enhanced each other's effects and which combinations should be avoided because of potential harmful interactions. The neurological understanding demonstrated by indigenous healers reveals sophisticated knowledge of brain function and nervous system disorders that was remarkably advanced for its time. They had identified numerous plants with specific neurological effects and developed precise protocols for treating various brain and nervous system conditions. Epilepsy treatments used by many tribes involved specific plant medicines that modern research has confirmed contain anticonvulsant compounds. Traditional healers understood that seizure disorders required ongoing treatment and had developed long-term management protocols that kept patients stable for years. Depression and anxiety treatments incorporated plant medicines with proven mood-stabilizing properties, combined with community support systems that addressed the social and spiritual factors contributing to mental health problems. These comprehensive approaches often achieved better outcomes than modern pharmaceutical treatments alone. Memory and cognitive enhancement protocols used by traditional healers helped maintain mental function in elderly patients and supported cognitive development in children. These protocols combined specific plant medicines with mental exercises and social activities that promoted brain health throughout the lifespan. The surgical anesthesia techniques developed by indigenous peoples were remarkably sophisticated and often more effective than early European surgical methods. Traditional surgeons had identified multiple plant compounds with anesthetic properties and developed precise protocols for achieving different levels of surgical anesthesia. Local anesthesia techniques using plant-based compounds could provide complete pain relief for specific body areas without affecting consciousness or overall body function. These techniques were particularly valuable for minor surgical procedures and wound treatment, where general anesthesia wasn't necessary. General anesthesia protocols could render patients completely unconscious during major surgical procedures while maintaining vital functions and allowing for safe recovery. These protocols required precise dosing and careful monitoring that demonstrated sophisticated understanding of anesthetic principles. Analgesic combinations provided extended pain relief during post-operative recovery periods without the addiction potential of modern opioid medications. Traditional pain management protocols were designed for long-term use and could be safely continued for weeks or months during healing. The obstetric and gynecological knowledge of indigenous healers was particularly advanced and often superior to European medical practice well into the modern era. Traditional midwives had developed comprehensive understanding of reproductive health, pregnancy management, and childbirth complications that achieved excellent outcomes for mothers and babies. Pregnancy nutrition protocols ensured that expectant mothers received optimal nutrition for fetal development while maintaining their own health throughout pregnancy. These protocols were based on detailed understanding of nutritional needs during different stages of pregnancy and included specific plant medicines that supported healthy development. Labor management techniques helped women through difficult births using position changes, massage, plant medicines, and psychological support that reduced complications and improved outcomes. Traditional midwives understood the mechanics of childbirth and had developed interventions that could correct many birth complications without surgical intervention. Postpartum care protocols supported new mothers through the recovery period, with specific plant medicines that promoted healing, prevented infection, and supported breastfeeding. These protocols also included community support systems that ensured new mothers received adequate rest and assistance during the vulnerable postpartum period. Contraceptive knowledge allowed women to control their fertility using various plant medicines that could prevent pregnancy or space births according to family needs. This knowledge was carefully guarded and transmitted only to women who needed it, reflecting sophisticated understanding of reproductive autonomy and family planning. The pediatric medicine developed by indigenous healers addressed the unique health needs of children with specialized treatments that were both safe and effective for young patients. Traditional healers understood that children weren't just small adults and required different approaches to diagnosis and treatment. Growth and development support protocols ensured that children received proper nutrition and health care during critical developmental periods. These protocols included specific plant medicines that supported healthy growth, immune system development, and cognitive maturation. Childhood disease treatments addressed common pediatric conditions using gentle plant medicines and supportive care that minimized discomfort while promoting recovery. Traditional healers had developed specific protocols for treating childhood illnesses that were both effective and appropriate for young patients. Behavioral and developmental disorder treatments helped children with learning difficulties, attention problems, and developmental delays using plant medicines combined with educational and social interventions. These comprehensive approaches often achieved better outcomes than modern treatments that focus primarily on symptom management. The geriatric medicine practiced by indigenous healers provided comprehensive care for elderly community members that maintained dignity and quality of life while managing age-related health conditions. Traditional healers understood that aging presented unique health challenges that required specialized approaches. Arthritis and joint pain management used specific plant medicines and physical therapies that reduced inflammation and maintained mobility in elderly patients. These treatments were designed for long-term use and could safely provide pain relief for years without harmful side effects. Cognitive decline prevention protocols helped maintain mental function in elderly patients using plant medicines that supported brain health combined with mental exercises and social engagement activities. These protocols often slowed or prevented the cognitive decline that was considered inevitable in aging. End-of-life care provided compassionate support for dying patients and their families using pain management techniques, psychological counseling, and spiritual guidance that eased the transition from life to death. Traditional healers understood that dying well was as important as living well and had developed protocols that honored the dignity of dying patients. The infectious disease management developed by indigenous peoples was remarkably effective and often prevented the spread of epidemics that could devastate communities. Traditional healers had identified numerous antimicrobial plants and developed comprehensive protocols for treating various types of infections. Bacterial infection treatments used plant medicines with proven antibiotic properties combined with supportive care that helped patients recover from serious bacterial illnesses. These treatments were often more effective than early European medical approaches and had fewer harmful side effects. Viral infection management focused on supporting immune function and managing symptoms while the body fought off viral diseases. Traditional healers understood that viral infections couldn't be cured directly and developed supportive care protocols that helped patients recover more quickly and completely. Fungal infection treatments use specific plant medicines with antifungal properties to treat skin infections, respiratory fungal diseases, and systemic fungal conditions. These treatments were particularly important in humid environments where fungal infections were common and potentially serious. Parasitic disease management addressed internal and external parasites using plant medicines that could eliminate parasites without harming the patient. Traditional healers had developed comprehensive protocols for treating various types of parasitic infections that were common in their environments. The trauma and emergency medicine practiced by indigenous peoples provided immediate care for injuries and acute medical emergencies that required rapid intervention. Traditional healers had developed sophisticated emergency protocols that could save lives in critical situations. Shock and blood loss management used specific plant medicines and treatment techniques that could stabilize patients who had lost significant blood due to injuries or illness. These protocols were essential for survival in environments where major injuries were common and modern emergency care wasn't available. Poisoning and overdose treatments addressed accidental poisoning from plants, animal venoms, or excessive doses of medicines using specific antidotes and supportive care protocols. Traditional healers had extensive knowledge of toxicology and could treat various types of poisoning effectively. Burn and wound care protocols provided immediate treatment for serious injuries that could become life-threatening if not properly managed. Traditional healers understood the principles of wound healing and infection prevention and had developed treatment approaches that promoted rapid healing with minimal complications. Hypothermia and heat-related illness treatments addressed environmental health emergencies that were common in extreme climates. Traditional healers had developed specific protocols for treating temperature-related illnesses that could quickly become fatal without proper intervention. The rehabilitation and physical therapy developed by indigenous healers helped patients recover full function after injuries or illnesses that caused disability. Traditional healers understood that recovery often required extended treatment and had developed comprehensive rehabilitation protocols. Mobility restoration techniques helped patients regain movement and strength after injuries that affected their ability to walk or use their limbs. These techniques combined specific exercises with plant medicines that reduced inflammation and promoted tissue healing. Strength-building protocols helped patients rebuild muscle mass and physical capacity after illnesses or injuries that caused weakness and deconditioning. These protocols were carefully designed to gradually increase activity levels without causing re-injury or setbacks. Coordination and balance training helped patients recover fine motor skills and balance after neurological injuries or illnesses. Traditional healers understood that these skills required specific training and had developed exercises that promoted neurological recovery. Pain management during rehabilitation used plant medicines and physical techniques that controlled pain while allowing patients to participate in recovery activities. Traditional healers understood that effective rehabilitation required pain control, but also recognized that some discomfort was normal during recovery. The integration of all these medical specialties created comprehensive healthcare systems that could address virtually any health problem that might affect indigenous communities. These systems demonstrated that sophisticated medical care was possible without modern technology or centralized institutions. The quality outcomes achieved by indigenous healthcare systems were often superior to European medical practice and compared favorably with modern healthcare in many areas. Traditional healers achieved excellent results in surgery, obstetrics, trauma care, and chronic disease management using methods that were both effective and sustainable. The cost-effectiveness of indigenous healthcare systems was remarkable, providing comprehensive medical care for entire communities using locally available resources and volunteer labor from trained healers. These systems proved that excellent healthcare didn't require expensive technology or complex institutions. The accessibility of indigenous healthcare ensured that all community members could receive appropriate medical care regardless of their social status or economic condition. Traditional healing systems were designed to serve entire communities rather than just wealthy elites. The sustainability of indigenous healthcare systems allowed them to operate effectively for thousands of years without depleting natural resources or creating environmental damage. These systems demonstrated that healthcare could be both comprehensive and environmentally responsible. The cultural integration of indigenous healthcare systems ensured that medical care was compatible with community values and social structures. Traditional healing wasn't separate from community life, but was integrated into the cultural and spiritual fabric of indigenous societies. The innovation capacity of indigenous healthcare systems allowed them to continuously adapt and improve while maintaining their core effectiveness. Traditional healers were constantly developing new techniques and approaches while preserving valuable historical knowledge. The knowledge preservation systems used by indigenous peoples ensured that medical expertise was accurately transmitted across generations without written records. These systems proved that complex medical knowledge could be preserved and maintained through oral traditions and practical apprenticeships. The global influence of indigenous medical knowledge continues to shape modern healthcare development in ways that are often unrecognized. Many of the most important advances in modern medicine have their roots in knowledge systems developed by indigenous peoples thousands of years ago. The future relevance of indigenous medical knowledge will likely increase as modern healthcare faces mounting challenges that require innovative solutions. The holistic approaches, sustainable practices, and community-based care models developed by indigenous peoples offer valuable alternatives to conventional medical approaches that are becoming increasingly expensive and unsustainable. The therapeutic communities created by indigenous peoples represent perhaps the most sophisticated approach to mental health and social healing ever developed. These weren't just groups of people who happened to live together. They were carefully designed social structures that promoted psychological well-being and prevented mental health problems before they could develop into serious conditions. The talking circles practiced by many tribes created safe spaces where individuals could process traumatic experiences while receiving support from community members who understood their struggles. These circles operated on principles that modern psychotherapy is only beginning to understand. Participants spoke without interruption, while others listened with complete attention. No advice was given unless requested. The focus was on witnessing and validating experiences rather than trying to fix or change people. The healing power of these circles came from their ability to transform individual trauma into shared community experience. When someone spoke about their pain, it became part of the collective memory of the group. This sharing process prevented trauma from becoming isolated within individuals, where it could fester and cause long-term psychological damage. Instead, traumatic experiences became integrated into community wisdom that could help others facing similar challenges. The seasonal ceremony cycles practiced by many indigenous communities provided year-round mental health maintenance that prevented psychological problems while building community resilience. These ceremonies weren't just religious observances, but sophisticated psychological interventions designed to address the emotional challenges that came with different times of the year. Spring renewal ceremonies helped community members process the isolation and hardships of winter, while preparing mentally and emotionally for the active months ahead. These ceremonies provided structured ways to release negative emotions accumulated during difficult winter months and set positive intentions for the coming year. Participants would often share their winter struggles and receive community support for moving forward. Summer celebration ceremonies reinforce community bonds and cultural identity during the most active and social time of the year. These ceremonies reminded people of their connections to each other and to their cultural traditions, while providing opportunities for joy and celebration that promoted psychological well-being. The shared excitement and collective participation in these ceremonies created powerful emotional experiences that strengthened community cohesion. Fall harvest ceremonies provided ways to process the year's experiences while preparing psychologically for winter isolation. These ceremonies helped people reflect on their accomplishments and challenges while building the mental resilience needed for surviving winter hardships. The community came together to share stories, express gratitude, and prepare emotionally for the difficult months ahead. Winter storytelling ceremonies provided psychological support during the most challenging time of the year. Long winter nights were filled with carefully crafted stories that taught important life lessons, while providing entertainment and emotional connection during periods of physical isolation. These stories weren't just entertainment, but therapeutic interventions that helped people maintain hope and perspective during difficult times. The conflict resolution systems developed by indigenous peoples created sophisticated mechanisms for addressing interpersonal disputes and community tensions before they could escalate into violence or social breakdown. These systems recognized that unresolved conflict was a major threat to both individual and community health, and developed comprehensive approaches for restoring harmony. The peacemaking circles used by many tribes brought conflicted parties together in structured settings where they could express their grievances while working toward resolution. These circles operated on restorative rather than punitive principles. The goal wasn't to punish wrongdoers, but to heal relationships and restore community harmony. All stakeholders had opportunities to speak and be heard, while the community worked together to find solutions that addressed everyone's needs. The mediation techniques used by traditional peacemakers were remarkably sophisticated and often more effective than modern legal approaches. These mediators understood human psychology and group dynamics in ways that allowed them to guide conflicted parties toward resolution. They knew how to create safe spaces for difficult conversations and how to help people find common ground, even in seemingly impossible situations. The restitution protocols developed by indigenous communities focused on repairing harm rather than inflicting punishment. When someone caused damage to another person or to the community, the focus was on making things right rather than making the offender suffer. This approach recognized that punishment alone didn't heal relationships or prevent future problems, and that true justice required addressing the underlying causes of harmful behavior. The community healing ceremonies used after serious conflicts helped restore social harmony and prevent ongoing resentment or revenge cycles. These ceremonies provided structured ways for communities to process traumatic events, while reaffirming their commitment to peaceful coexistence. Participants would often share their feelings about what had happened and work together to prevent similar problems in the future. The addiction and substance abuse treatment developed by indigenous peoples was remarkably effective and often more successful than modern treatment approaches. Traditional healers understood that addiction was a complex condition that required addressing psychological, spiritual, and social factors as well as physical dependence. The detoxification protocols used by traditional healers helped addicted individuals safely withdraw from substances while managing withdrawal symptoms and preventing dangerous complications. These protocols combined specific plant medicines that ease withdrawal symptoms with supportive care that address the emotional and spiritual aspects of recovery. The counseling techniques used by traditional healers helped addicted individuals understand the underlying causes of their substance use while developing healthier coping strategies. These techniques often involved extensive individual counseling combined with group support and community involvement that addressed all aspects of the addiction problem. The spiritual healing ceremonies used in addiction treatment helped individuals reconnect with their cultural identity and spiritual beliefs, while finding meaning and purpose that supported long-term recovery. These ceremonies provided powerful transformational experiences that often marked turning points in recovery journeys. The community reintegration programs used by indigenous peoples helped recovering individuals rebuild their lives while maintaining their sobriety. These programs provided practical support for employment, housing, and social relationships, while continuing to address the ongoing challenges of maintaining recovery in challenging environments. The family therapy approaches developed by indigenous peoples addressed the complex family dynamics that often contributed to individual health problems. Traditional healers understood that individual illness often reflected family dysfunction and that successful treatment required addressing family as well as individual issues. The family assessment techniques used by traditional healers evaluated communication patterns, role relationships, conflict resolution skills, and emotional support systems within families. These assessments helped identify family problems that might be contributing to individual health issues while revealing family strengths that could support healing. The family intervention strategies used by traditional healers helped families change dysfunctional patterns while building healthier relationships. These interventions often involved structured family meetings where members could express their concerns while working together to develop solutions that supported everyone's well-being. The extended family support systems developed by indigenous communities created networks of relationships that provided comprehensive support for individual and family health. These systems recognized that nuclear families alone often couldn't provide all the support needed for optimal health and created broader kinship networks that shared responsibility for community well-being. The intergenerational healing programs used by indigenous peoples addressed trauma and dysfunction that was passed down through family lines. These programs helped families understand how historical trauma affected current generations, while developing strategies for breaking negative patterns and creating healthier legacies for future generations. The occupational therapy developed by indigenous peoples helped individuals develop skills and find meaningful work that contributed to both personal satisfaction and community well-being. Traditional healers understood that purposeful activity was essential for mental health and had developed comprehensive approaches for helping people find their place in community life. The skill development programs used by indigenous communities taught essential life skills while building self-confidence and social connections. These programs were carefully designed to match individual abilities and interests with community needs, while providing progressive training that led to mastery and recognition. The work therapy protocols used by traditional healers helped individuals recovering from illness or injury gradually return to productive activity. These protocols were carefully designed to match work demands with individual capabilities, while providing the satisfaction and social connection that came from meaningful contribution to community life. The leadership development programs used by indigenous communities identified and trained individuals with leadership potential, while ensuring that leadership roles were filled by people who would serve community rather than personal interests. These programs combined skill training with character development and cultural education that prepared leaders for their responsibilities. The mentorship systems used by indigenous peoples created relationships between experienced and inexperienced community members that facilitated knowledge transfer while providing emotional support and guidance. These relationships often lasted for decades and created strong bonds that benefited both mentors and mentees. The environmental therapy, developed by indigenous peoples, recognized that natural environments had powerful healing properties that could enhance recovery from both physical and mental health conditions. Traditional healers understood that connection to nature was essential for human well-being and had developed systematic approaches for using natural environments therapeutically. The wilderness therapy programs used by many tribes involved taking patients into natural settings where they could experience the healing power of nature while learning essential survival and life skills. These programs were particularly effective for treating psychological problems and helping individuals develop self-confidence and resilience. The garden therapy, approaches used by indigenous communities, involved patients in growing food and medicinal plants while teaching them about nutrition and plant medicine. These programs provided both physical activity and meaningful work, while connecting people to the natural cycles that governed health and healing. The animal therapy techniques used by some tribes involved interactions with domestic and wild animals that provided emotional support and therapeutic benefits. These interactions helped people develop empathy and compassion while providing comfort and companionship that supported healing. The seasonal therapy programs used by indigenous communities helped people align their activities and expectations with natural cycles while taking advantage of the different therapeutic opportunities available during different times of the year. These programs recognized that human needs varied seasonally and developed appropriate interventions for different times. The art and creative therapy developed by indigenous peoples used various forms of artistic expression to promote healing and personal growth. Traditional healers understood that creativity was essential for psychological well-being and had developed sophisticated approaches for using art therapeutically. The painting and drawing therapy used by many tribes helped individuals express emotions and experiences that were difficult to put into words. These artistic expressions often revealed important information about psychological state while providing cathartic release of difficult emotions. The sculpture and carving therapy approaches helped people work through grief and trauma while creating meaningful objects that honored their experiences. These activities provided both physical and emotional benefits while connecting people to cultural traditions and artistic heritage. The music and dance therapy techniques used by indigenous communities provided powerful ways to express emotion while building community connections and cultural identity. These activities were particularly effective for treating depression and anxiety while promoting social bonding and cultural continuity. The storytelling therapy approaches used by traditional healers helped people make sense of their experiences while connecting to cultural wisdom and community support. These therapeutic stories provided frameworks for understanding difficult experiences while offering hope and guidance for moving forward. The spiritual counseling developed by indigenous peoples addressed the spiritual dimensions of health and illness that were often ignored by other healing traditions. Traditional healers understood that spiritual well-being was essential for complete health and had developed comprehensive approaches for addressing spiritual problems. The Vision Quest counseling used by many tribes helped individuals find life direction and purpose while developing spiritual connection and personal strength. These intensive spiritual journeys provided profound transformational experiences that often resolve psychological problems while building resilience and self-confidence. The prayer and meditation counseling taught individuals how to use spiritual practices for stress management and emotional regulation while developing deeper connection to cultural traditions and spiritual beliefs. These practices provided ongoing support for mental health while building spiritual resources that could be accessed during difficult times. The ancestral counseling approaches helped individuals connect with cultural heritage and family wisdom while resolving conflicts between traditional and modern values. These counseling techniques provided ways to honor cultural traditions while adapting to changing circumstances and modern challenges. The ceremonial counseling used by traditional healers provided structured spiritual experiences that promoted healing while reinforcing cultural identity and community connections. These ceremonies created powerful shared experiences that often marked important transitions or turning points in healing journeys. The crisis intervention systems developed by indigenous peoples provided immediate support for individuals experiencing acute psychological distress while preventing mental health emergencies from escalating into serious problems. Traditional healers understood that rapid intervention was essential for preventing psychological crises from becoming chronic conditions. The suicide prevention protocols used by indigenous communities identified warning signs and risk factors while providing immediate intervention and ongoing support for individuals at risk. These protocols were based on understanding of the social and spiritual factors that contributed to suicidal ideation, while providing comprehensive support for people in crisis. The domestic violence intervention systems addressed family violence through community accountability and healing rather than punishment alone. These systems recognized that domestic violence was often a symptom of broader social problems and developed comprehensive approaches that addressed root causes while protecting victims. The child abuse prevention and intervention programs protected children while helping families develop healthier parenting skills and support systems. These programs recognized that child abuse often resulted from family stress and social isolation, and provided comprehensive support that addressed underlying causes. The elder abuse prevention systems protected vulnerable elderly community members while ensuring that they received appropriate care and respect. These systems recognized that elder abuse often resulted from caregiver stress and lack of support, and developed community-wide approaches that shared responsibility for elder care. The community trauma healing programs addressed collective trauma that affected entire communities following wars, epidemics, natural disasters, or other catastrophic events. These programs recognized that individual healing couldn't occur in traumatized communities and developed comprehensive approaches that addressed both individual and collective trauma. The historical trauma healing approaches helped communities process the ongoing effects of colonization, forced relocation, cultural suppression, and other historical injustices that continued to affect community health and well-being. These approaches recognized that historical trauma was passed down through generations and required specific interventions that addressed both historical and contemporary effects. The disaster recovery programs helped communities rebuild after natural disasters while processing the psychological trauma associated with loss and displacement. These programs provided both practical support for rebuilding and emotional support for processing grief and trauma. The war trauma healing ceremonies helped warriors and their families process the psychological effects of combat while reintegrating veterans into peaceful community life. These ceremonies provided structured ways to honor military service while addressing the emotional and spiritual wounds caused by warfare. The epidemic trauma recovery programs helped communities heal after devastating disease outbreaks that caused widespread death and social disruption. These programs provided ways to honor the dead while helping survivors process grief and rebuild community structures. The integration of all these psychological and social healing approaches created comprehensive mental health systems that addressed every aspect of emotional and spiritual well-being. These systems demonstrated that sophisticated psychological care was possible within community-based healing traditions that emphasized relationship and meaning rather than individual pathology. The outcomes achieved by indigenous mental health systems were often superior to modern psychiatric care and provided models for developing more effective and humane approaches to psychological healing. Traditional healers achieved excellent results in treating depression, anxiety, trauma, addiction, and other mental health conditions using methods that were both effective and culturally appropriate. The prevention focus of indigenous mental health systems was particularly advanced and often prevented psychological problems before they required intensive intervention. These systems recognized that maintaining mental health was easier than treating mental illness and developed comprehensive prevention programs that promoted psychological well-being throughout the lifespan. The community integration of indigenous mental health care ensured that psychological healing was supported by strong social networks and cultural connections rather than isolated individual treatment. This community-based approach often achieved better long-term outcomes than individual therapy alone. The holistic approach of indigenous mental health systems addressed psychological, spiritual, social, and physical aspects of mental health simultaneously rather than treating these dimensions separately. This comprehensive approach recognized that mental health problems often had multiple causes that required coordinated intervention. The cultural relevance of indigenous mental health approaches ensured that treatment was compatible with community values and beliefs, rather than imposing external frameworks that might conflict with cultural identity. This cultural integration often improved treatment engagement and outcomes. The sustainability of indigenous mental health systems allowed them to provide ongoing support for community psychological well-being, using local resources and volunteer healers rather than expensive professional services. These systems proved that comprehensive mental health care could be both effective and affordable, and the innovation capacity of indigenous mental health systems allowed them to adapt to new challenges while maintaining their core effectiveness. Traditional healers could develop new approaches for addressing novel psychological problems while preserving valuable traditional knowledge and techniques. The wisdom embedded in indigenous mental health traditions offers profound insights into the nature of psychological healing that continue to influence modern therapeutic approaches. These traditions demonstrate that effective mental health care requires understanding the complex relationships between individual psychology and social environment. The legacy of indigenous psychological healing continues to inspire and guide modern mental health development, while offering hope for creating more effective and compassionate approaches to psychological care that serve all of humanity, while honoring the wisdom of the peoples who first developed these remarkable healing traditions. The rehabilitation medicine systems developed by indigenous peoples created comprehensive recovery protocols that addressed not just the immediate effects of illness or injury, but the long-term process of returning to full community participation. These weren't simple physical therapy routines, but sophisticated understanding of how healing progressed through predictable stages that required different interventions at different times. Traditional healers understood that recovery was rarely linear. Patients might make significant progress for weeks, then experience setbacks that required adjusting treatment approaches. They had developed flexible protocols that could adapt to individual recovery patterns while maintaining momentum toward full healing. This understanding of recovery dynamics was remarkably advanced and often more realistic than modern expectations of steady improvement. The physical rehabilitation techniques used by indigenous healers were based on detailed understanding of human biomechanics and movement patterns. They knew which muscles needed strengthening after specific injuries and which joints required mobility work to restore function. They understood that different types of injuries required different approaches to rehabilitation and had developed specialized protocols for various conditions. Water therapy was extensively used by tribes living near rivers, lakes, or hot springs. They understood that water provided natural resistance for strengthening exercises while supporting body weight to reduce stress on healing tissues. Cold water was used to reduce inflammation and pain, while warm water promoted circulation and relaxation. These hydrotherapy techniques were often more sophisticated than similar treatments developed in Europe centuries later. Movement therapy incorporated specific exercises designed to restore normal movement patterns after injuries that had caused compensatory movement habits. Traditional healers understood that favoring an injured body part could lead to problems in other areas and developed comprehensive movement retraining that addressed the whole body rather than just the injured area. Massage therapy was used systematically throughout the rehabilitation process, with different techniques applied at different stages of healing. Gentle massage was used immediately after injury to promote circulation and reduce swelling. Deeper massage was used later to break up scar tissue and restore normal tissue flexibility. Specialized massage techniques were used to address specific problems like muscle spasms or joint stiffness. The occupational rehabilitation approaches developed by indigenous healers helped injured individuals return to their essential life activities while adapting to any permanent limitations caused by their injuries. These approaches recognized that meaningful work and social contribution were essential for psychological well-being and developed creative solutions for helping people remain productive despite physical limitations. Adaptive tool development created modified implements that allowed people with disabilities to participate fully in community life. Injured hunters might receive specially designed weapons that compensated for reduced strength or mobility. Craftspeople with hand injuries might get modified tools that allowed them to continue their specialized work. These adaptations were individually designed and often remarkably ingenious. Task modification approaches broke down complex activities into smaller steps that could be mastered gradually during recovery. Traditional healers understood that returning to full activity too quickly could cause re-injury, but that remaining inactive too long could lead to permanent disability. They developed progressive activity programs that safely increased demands while building confidence and capability. Work hardening protocols prepared recovering individuals for return to their normal occupations by gradually increasing the physical demands of their activities. These protocols were carefully designed to match the specific requirements of different types of work, while ensuring that individuals were truly ready for full activity before being cleared to return. Community integration support helped recovering individuals rebuild their social relationships and community roles while adjusting to any changes in their capabilities. Traditional healers understood that physical recovery was only part of the healing process, and that successful rehabilitation required addressing social and psychological aspects of recovery as well. The pain management systems used throughout rehabilitation were comprehensive and sophisticated, combining multiple approaches to control pain while promoting healing. Traditional healers understood that uncontrolled pain could interfere with recovery, while excessive pain medication could delay healing and create dependency problems. Herbal pain management used specific plant medicines that provided effective pain relief without the side effects of synthetic medications. Different plants were used for different types of pain, and combinations were carefully crafted to address individual pain patterns. These herbal protocols could be safely used for extended periods during long recovery processes. Physical pain management techniques included heat therapy, cold therapy, massage, acupressure, and positioning strategies that reduced pain through non-pharmacological means. These techniques were taught to patients and their families so that pain management could continue between formal treatment sessions. Distraction therapy used engaging activities that occupied the mind and reduced pain perception through psychological mechanisms. Traditional healers understood that pain was influenced by attention and emotional state and developed various distraction techniques that could be used when other pain management approaches weren't sufficient. Relaxation therapy taught patients how to use breathing techniques, meditation, and mental imagery to reduce pain and promote healing. These techniques were particularly valuable for managing chronic pain conditions that required long-term pain management strategies. The nutrition therapy used during rehabilitation was carefully designed to support healing while meeting the changing nutritional needs that occurred during different stages of recovery. Traditional healers understood that proper nutrition was essential for healing and had developed specific dietary protocols for various types of injuries and illnesses. Healing foods were identified for their specific therapeutic properties and incorporated into recovery diets in precise combinations. Anti-inflammatory foods were used to reduce swelling and promote healing. High-protein foods were emphasized during tissue repair phases. Energy-dense foods were provided when metabolic demands were high during active healing. Supplemental nutrition addressed specific nutritional deficiencies that could interfere with healing or recovery. Traditional healers knew which nutrients were most important for different types of healing and had identified plant sources that could provide these nutrients in bioavailable forms. Digestive support was provided for patients whose injuries or illnesses had affected their ability to digest and absorb nutrients properly. Gentle, easily digestible foods were used during acute phases, while digestive stimulants were used to restore normal digestive function during recovery. Hydration protocols ensured that patients received adequate fluids to support circulation, waste elimination, and cellular function during healing. Traditional healers understood that dehydration could significantly impair healing and had developed various ways to encourage fluid intake in patients who might have reduced appetite or difficulty drinking. The psychological rehabilitation developed by indigenous healers addressed the emotional and mental challenges that often accompanied physical injuries or illnesses. Traditional healers understood that physical trauma often caused psychological trauma, and that complete recovery required addressing both dimensions of the healing process. Counseling techniques helped patients process the emotional impact of their injuries while developing coping strategies for dealing with pain, disability, and changes in their life circumstances. These counseling approaches were often more effective than modern psychological interventions because they were integrated with cultural values and community support. Confidence-building exercises helped patients overcome fear and anxiety that often developed after traumatic injuries. Traditional healers understood that fear of re-injury could prevent full recovery and had developed specific techniques for helping patients regain confidence in their physical abilities. Goal-setting approaches helped patients maintain motivation during long recovery processes by breaking down the return to full function into achievable milestones. These goal-setting techniques were realistic but optimistic, helping patients maintain hope while working steadily toward recovery. Support group participation connected recovering individuals with others who had faced similar challenges while providing opportunities to share experiences and learn from each other. These support groups were often more effective than individual counseling because they provided peer understanding and mutual encouragement. The family education programs developed by indigenous healers ensured that family members could provide appropriate support during recovery while understanding their loved ones' limitations and capabilities. Traditional healers recognized that family support was essential for successful rehabilitation and had developed comprehensive family training programs. Caregiver training taught family members how to provide physical care, emotional support, and practical assistance during recovery. This training included specific techniques for helping with mobility, personal care, and daily activities while avoiding overprotection that could interfere with recovery progress. Communication skills. Training helped families learn how to talk about the injury or illness and its effects in ways that promoted healing rather than focusing on limitations or losses. These communication techniques helped maintain positive family relationships during stressful recovery periods. Adaptation strategies helped families adjust their expectations and routines to accommodate the recovering individual's changing needs while maintaining normal family functioning as much as possible. These strategies recognized that the whole family was affected by serious injuries or illnesses and needed support for their own adjustment process. Long-term planning helped families prepare for the possibility of permanent changes in their loved ones' capabilities while maintaining hope for maximum recovery. This planning included practical considerations like work modifications and lifestyle adjustments, as well as emotional preparation for potential outcomes. The outcome measurement systems used by traditional healers tracked recovery progress using multiple indicators of healing and function rather than focusing solely on symptom resolution. These measurement systems provided comprehensive assessment of recovery that guided treatment modifications and predicted long-term outcomes. Functional assessment evaluated the patient's ability to perform essential life activities and compared current function with pre-injury capabilities. These assessments were practical and focused on real-world activities rather than abstract measures that might not reflect actual functional capacity. Pain assessment used sophisticated understanding of different types of pain and their implications for healing progress. Traditional healers could distinguish between normal healing pain and problematic pain that might indicate complications or inadequate treatment. Quality of life assessment evaluated the patient's overall satisfaction with their recovery and their ability to find meaning and purpose despite any remaining limitations. These assessments recognized that successful rehabilitation involved more than just physical recovery. Community integration assessment evaluated how well recovering individuals were able to resume their roles and relationships within their communities. This assessment recognized that social recovery was as important as physical recovery for overall well-being. The follow-up care systems developed by indigenous healers provided ongoing support for individuals who had completed acute rehabilitation but still needed periodic monitoring and assistance. Traditional healers understood that recovery was often a long-term process that required sustained support rather than brief, intensive intervention. Maintenance therapy provided ongoing treatment to prevent deterioration and maintain gains achieved during active rehabilitation. This therapy was typically less intensive than acute treatment, but was continued for as long as needed to ensure stable recovery. Monitoring protocols tracked long-term outcomes and identified potential problems before they became serious. These protocols included regular assessment of function, pain levels, and overall well-being with appropriate interventions when problems were identified. Refresher training provided periodic review and practice of self-care techniques, exercises, and adaptive strategies to ensure that patients maintained their recovery skills over time. This training recognized that skills could deteriorate without practice and reinforcement. Crisis intervention provided immediate support when recovering individuals experienced setbacks, complications, or new problems that threatened their recovery progress. This intervention was available as needed and could be rapidly mobilized when situations required immediate attention. The research and development activities conducted by indigenous rehabilitation specialists continuously improved treatment methods through careful observation and analysis of recovery outcomes. Traditional healers were constantly learning from their experiences and refining their approaches based on what worked best for different types of patients and conditions. Outcome tracking systems maintained detailed records of which treatments produced the best results for different conditions, while identifying factors that predicted successful recovery. This information was used to improve treatment protocols and patient selection criteria. Innovation development encouraged healers to experiment with new techniques and approaches while maintaining respect for traditional knowledge. This balance between innovation and tradition allowed rehabilitation medicine to evolve and improve while preserving valuable historical knowledge. Quality improvement processes regularly reviewed treatment outcomes and patient satisfaction to identify areas where improvements were needed. These processes ensured that rehabilitation services remained effective and responsive to patient needs. Knowledge-sharing systems facilitated the exchange of rehabilitation knowledge between different healers and communities while promoting best practices and preventing the repetition of ineffective approaches. These systems created networks of rehabilitation expertise that benefited patients throughout indigenous communities. The training programs for rehabilitation specialists prepared healers to provide comprehensive recovery services while maintaining the highest standards of care. These training programs were extensive and rigorous, requiring mastery of multiple disciplines and extensive practical experience under expert supervision. Apprenticeship programs provided hands-on training under experienced rehabilitation specialists while ensuring that essential knowledge and skills were accurately transmitted. These programs typically lasted several years and included both theoretical knowledge and practical skills development. Specialty training allowed healers to develop expertise in specific types of rehabilitation while maintaining competence in general rehabilitation principles. This specialization improved outcomes for complex cases while ensuring that all rehabilitation needs could be addressed. Continuing education ensured that practicing rehabilitation specialists remained current with new developments and maintained their skills throughout their careers. This education included both formal training sessions and informal peer learning opportunities. Competency assessment verified that rehabilitation specialists possessed the knowledge and skills necessary for safe and effective practice. These assessments were comprehensive and included both theoretical knowledge and practical skills evaluation. The ethical standards maintained by rehabilitation specialists ensured that patient welfare remained the primary focus of all rehabilitation activities, while protecting vulnerable individuals from exploitation or inadequate care. These ethical standards were strictly enforced and formed the foundation of professional rehabilitation practice. Patient advocacy principles required rehabilitation specialists to prioritize patient needs and preferences, while ensuring that patients received appropriate care regardless of their social status or ability to provide compensation. These principles protected vulnerable patients while maintaining professional integrity. Confidentiality requirements protected patient privacy while allowing for appropriate consultation and collaboration among healers. These requirements balanced patient rights with the need for effective treatment coordination. Informed consent practices ensured that patients understood their treatment options and could make informed decisions about their care. These practices respected patient autonomy while providing the information needed for good decision-making. Quality assurance systems maintained high standards of rehabilitation care while identifying and addressing problems that could affect patient outcomes. These systems provided accountability and continuous improvement that benefited all patients. Professional development requirements ensured that rehabilitation specialists continued to grow and improve throughout their careers while contributing to the advancement of rehabilitation knowledge. These requirements balanced individual professional growth with community service obligations. The integration of rehabilitation medicine with other aspects of indigenous healthcare created comprehensive recovery systems that addressed all aspects of healing and recovery. This integration ensured that rehabilitation was coordinated with other treatments while avoiding conflicts or duplication of services. Medical integration coordinated rehabilitation with ongoing medical treatment, while ensuring that all interventions worked together to promote recovery. This integration was essential for patients with complex conditions requiring multiple types of treatment. Psychological integration addressed the emotional and mental aspects of recovery while coordinating with physical rehabilitation activities. This integration recognized that psychological and physical recovery were interdependent and required coordinated intervention. Social integration helped recovering individuals rebuild their relationships and community roles while coordinating with other aspects of rehabilitation. This integration was essential for long-term recovery success and community reintegration. Spiritual integration addressed the spiritual dimensions of recovery while respecting individual beliefs and cultural traditions. This integration recognized that spiritual healing was often essential for complete recovery and community acceptance. Community integration involved the broader community in supporting recovery, while ensuring that recovering individuals could resume their roles and responsibilities as community members. This integration was essential for long-term recovery sustainability and social acceptance. The legacy of indigenous rehabilitation medicine continues to influence modern recovery approaches while offering valuable insights into effective rehabilitation practice. Many of the principles and techniques developed by traditional healers remain relevant and effective for contemporary rehabilitation challenges. Holistic approaches that address multiple dimensions of recovery simultaneously are increasingly recognized as superior to narrow medical approaches that focus only on specific symptoms or conditions. Indigenous rehabilitation medicine demonstrated the value of comprehensive approaches thousands of years before modern medicine began to understand their importance. Community-based rehabilitation models that involve families and communities in supporting recovery are being adopted by modern healthcare systems seeking more effective and sustainable rehabilitation approaches. Indigenous communities proved that community involvement could significantly improve recovery outcomes while reducing costs and improving satisfaction. Patient-centered care that respects individual preferences and cultural values while providing personalized treatment approaches is increasingly recognized as essential for effective rehabilitation. Indigenous healers always practiced patient-centered care and demonstrated its superiority over standardized approaches that ignored individual differences. Prevention-focused approaches that emphasize maintaining function and preventing disability are being adopted by modern rehabilitation systems seeking to improve outcomes while reducing costs. Indigenous rehabilitation medicine was always focused on prevention and demonstrated that maintaining function was more effective and efficient than trying to restore it after it was lost. The wisdom embedded in indigenous rehabilitation traditions offers guidance for developing more effective and humane approaches to recovery that serve all of humanity while honoring the remarkable achievements of the peoples who first developed these sophisticated rehabilitation systems. These traditions demonstrate that effective rehabilitation requires understanding the complex relationships between physical healing, psychological recovery, social reintegration, and spiritual renewal that must be addressed together for complete healing to occur. So here we are, after journeying through thousands of years of sophisticated medical knowledge that challenges everything we thought we knew about ancient healing. From willow bark that became aspirin to surgical procedures that outperformed Civil War medicine. From comprehensive mental health systems to botanical pharmacies that modern science is still discovering. These weren't primitive remedies or desperate attempts at healing. These were comprehensive medical traditions that understood something we're only beginning to grasp. That true healing requires addressing the whole person within their community and environment. The next time you take an aspirin, visit a therapist, or hear about holistic medicine, remember that you're experiencing the legacy of indigenous healers who perfected these approaches millennia ago. Their wisdom didn't disappear. It's woven into the fabric of everything we consider modern medicine today.